Good morning.
Good morning, my dear. How are you today?
I'm good. How are you?
I'm good, thank you. Welcome, sweetheart.
Good morning, ma'am.
Good morning, my dear. How are you today? You just woke up. Good. It's okay. Let's wait for Amrit today. He's always early, but I don't know why he's not early today. Let's wait for him and then we'll start.
Did you send the email yesterday regarding that topic?
I send it through. I asked Zishan to send it, but I see he hasn't sent it to us. It's okay. I'll do it.
Yeah, and I didn't get I'd asked him to give me the access code for the ebook. Yeah, but
You
I
did
haven't
not
got
get
it.
it?
No, actually, like the codes which we put in, they are just for the evolve resources. But you can't download your ebook through it.
Ebook you can download when you scan your book at the end.
Yeah, but I talked to the support people from the Evolve. They asked me like that your college was gonna provide you the access for that.
Maybe you can call them, ask them during the day later.
Yeah, okay.
Okay, no
Yeah,
worries. So
thank you.
you're very welcome. Good morning, everyone. For today, what we are gonna do is basically it says there is we need to complete the whole link, and then apart from that, the next thing that we need to complete is, let's see if you guys are not prepared, but then still. Schedule. The first thing that it is telling you to do is here. We did get through it. So what and with whom do you guys work with? What settings you work? We covered all those things. For today, we'll go through this body mechanics. This is a topic. And after that, we will share, each one of you will share those topics that bullets that are in your course outline. We will go through this course outline one by one. Each one will take a chance to speak over it, and we'll see what you guys have understood by that. Now, what I want you guys to do is, first of all, know the very, very important thing that is body mechanics for today, which is if you don't use your body mechanics properly, for sure and sure you would get into trouble. Just because you can hurt your back, you can end up into a lot of injuries. And for this, I would like to say this is our Zoom share screen, which is my screen, this one. So, are you guys able to see my screen? Yes. And we'll go for this
All are good.
one. When we talk about this body mechanics, this is personal hygiene, not personal hygiene. Can you see the topic body mechanics now?
Yes.
Okay, beautiful. Coming to this point of saying body mechanics, how it works, why is it important? When you are working, when I am working, when we all are working, this is going to play the most important role in your life. If we do not use proper body mechanics, we would end up with injuries, falls, and some injuries or falls can be very fatal, some can be very dangerous. And if you do not use your body mechanics properly, you will not also be covered. Saying covered means that if ever you are at work, you get hurt, something goes wrong, if you have used your body mechanics properly, you fill it out the form, you will get each and every fee reimbursed. Means if you need to go for your physio. If you take your days off, you will still be paid, and whatever things you might need, they will be paid for you. But if it's your fault that you haven't used a body mechanics, you will not be covered. Saying that you had a patient, you had a client who is a ceiling lift, and when we say ceiling lift, when we say total care, it means you cannot do, even turning is not possible to do of its own. You need to have two or more than two people, depending on how heavy the person is. For the basic criteria for total care is two people, but sometimes these total care people end up with three if they are very, very heavy. So if it was like that, and you think the facility thinks when you have to work with this client, you need to use a sling, you need to use a transfer sheet. Despite you did not, you tried to pull. When you pull, you got a muscle. You pull your muscle as well. You got hurt. It will not be covered. Or when we have to pull our client, when we have to pull our resident, we need to squat properly, pull our legs, and then push. Ask them, push it with your legs. But what if we don't do that thing? We don't use body mechanics, we would get into trouble. You are tall and the bed is at lowest position. You'll have to bend, and maybe it's okay to bend one time, but you are doing this job for 12 hours. You are doing this job every single day. Is it okay? No. Maybe one day you did not feel the pain, second day, but eventually, when you keep on working and you don't work properly, you will reach to a point where you will get hurt. That's why the proper body mechanics is when you are providing care to your client, you always you raise the bed at your waistline. That means when your bed is at waistline, you don't have to bend. You just have to little turn your head. That's also considered to be body mechanics. So all these things are very, very important. If you do not use your body mechanics and something goes wrong, again, nothing. Nobody will cover you. It doesn't only matter about covering, but you might end up with disability. You might end up with injuries. Your family might suffer because of it. Just because you got sick, you got injured, there will be stress, there will be other things laid off in your family. So we don't want things to happen. If you see a patient is falling, you run. And you run so fast that you might hurt yourself. Patient has already fallen. What we can do is provide assistance in a way where he or she would not hit her head. That's it. But we don't run from there to here just to save the client. We might also trip ourselves. So this is also, all these things are considered to be body mechanics. Helping, let's put this one here. Helping to prevent personal injuries. It's important to use your body correctly to avoid injuries during moving, positioning, transferring activities. I mentioned again, if you're not standing in a proper position with your legs caught and then you turn your body for transferring, you might hurt your back, you might pull your back muscles, you might injure yourself. So please be mindful of when you are turning, you use your leg muscles correctly. Don't use your back, you always use your leg muscles. You put stress on your leg muscles, not on your back. Otherwise, your back will be broken sooner the time it has to. Practicing and performing 10 warm-up exercises prior to initiating any moving, positioning, transferring activities will reduce the risk of an injury. Seek immediate medical attention for injuries. There's a box in your book. Proper body mechanic means moving the body in an efficient and careful way. It involves good posture, balance, using your strongest and largest muscle of the work, which is not your back muscles, those are your leg muscles. Always, and make sure your shoes are good. They can weight bear. They're not meant to just for going out. It should be a proper work shoes, first of all. Second, standing, gap between your two legs, just like you squat. Then when you transfer your patient, fold your knees, go on your knees. That's how you turn them. You don't turn them, you don't lift them. We never lift clients, we never lift residents. You always ask them, put the bed up, then in the turbulence position, so that it will go like a slope. And when you ask your client and your partner to pull, it will slide. Use a slider sheet always. Do not, because if you don't use a slider sheet, it will be difficult. Slider sheets are meant, they are on your side, they're strong cloth, but in the middle, the material is like sliding. It helps slide the patient up and down easily, for turning easily. Remember, good body mechanics reduces the risk of injury. Fatigue, muscle strains, and injury can result from improper use and positioning of body. Yes, I mentioned you will get burnt out easily. One day you will feel a little bit of pain in your neck, because when you do not raise your bed, you try to look down, clean your patient, help them find things, you will end up with neck pain. So always raise your bed according to your height. Always to the waistline of your body. Otherwise, you will see things, they do get very weird. You might not realize it the first day you are young, but then things do change. Body alignment, that is posture, is the way where your head, trunk, arms, legs are aligned with one another. Good alignment lets the body move and function with strength and efficacy. Body balance is achieved when a relatively low center of gravity is balanced over a wide, stable base of support. And also, when you are moving, repositioning your clients, you always let them know at the count of 3, we would slide up. You're gonna push with your legs. And your client will be holding and you will pull. No. So you will mention to your client, to your resident, please make sure that your arms, you're not touching these side rails. You will hug yourself. Once they hug themselves, it's easy to slide. If you're working in a residential homes, we have proper beds. You just have to play with them. They keep moving up and down. But hospital, some beds are okay. Some they don't have. There, it's very difficult to pull them. You will have to pull them. That's the time when you use proper body mechanics. Otherwise, when you work in other settings like community settings or residential settings, that proper bed, raise the bed up, then go in this turbulence bed position. It will go down. It will become like a slope, and then it's easy to slide the patient. All the time, remember, the beds are assigned in such a way that the leg part moves separate, the head part moves separate, and the whole thing goes up. So it's up to you when how you're repositioning your patient. Play with that thing and make sure that it's done. Your patient also should be aware of what you're doing. Just as I mentioned, folding arms, hugging themselves, pushing with their legs, making sure the pillow is not under the client's neck. It's already moved up, which will help to slide the patient easily. those are some of the things that you will have to pay attention to. The beds that are in the hospital, they're also aligned for all this, but sometimes we do have stretcher beds. Stretcher bed means they can move the head up a little bit, legs a little bit, and then completely up. They cannot turn uh, all the way every side. So that is why. But again, you can play with that thing, make it work according to what you need to work. Support of base of support is the area on which the object rests. Feet are about shoulder wide apart. I told you there should be always a gap between your 2 feet. And once you do something, you will bend your knees. You will try to squat as if you have to try and sit on a commode. So that's how you pull the patient. You do not pull the patient when your legs are when your feet are just close one to one. It might not, you might not realize the first day you do that, it will not affect you, but in 2 or 3 moments or 3 repositionings or 3 days, you will end up with backache. You'll start to get fatigued and backache. That's why it's always important a little bit space between the two of your legs, squat and then pull. Toes are pointed forward. Then again, you will stride 1 foot slightly, like you do it like this. When we go, you can see yourself when your 2 feet are apart, you do like this, you squat and then you get up. That's how exactly you move your clients, facing towards your client. The bed again at your waistline, even above your waistline. You might have to look into the patient. Is there a dressing? You would look down. Oh, okay, what happened? And you're talking and you're looking at it. You do it every day, you will hurt your neck. So there's a dressing or there's redness, I need to look at, make sure, make it up, so that you only have to do like this. You don't have to bend. Too much bending of your back. Why would we? We don't want to. It's not good. Use your strongest and largest muscles in the shoulder, upper arm, hips and thighs, not your back. Handle and move persons and heavy objects. When you are moving people, when you are moving heavy things, always make sure that you use the strongest muscles that you have. We don't lift everything on our back. We use our muscles. The gap between your arms should be your strength. You should be using it in a way, not that you're bending and then this, whatever you're lifting on your arms is again going on your neck. No, you do not. You use your arm muscles, not your neck muscles. If you try at home to lift, there's a proper way. When you lift with your arms and when you lift with, when there's a stress on your neck, we always use our hands to lift. But the way you use your muscles of your arms, making sure that you hold them in a way it's not giving stress to your neck. Your neck is not getting pulled off. Bend your knees and squat to lift a heavy object. This is how you use it, no matter whether you're working at home, no matter whether you're working somewhere else. Squatting is very, very important. Bending your knees, you use your lower and upper thigh muscles and your leg muscles. That's when you squat, what happens. But if you don't squat your legs, you don't create a space, then you are using your back muscles. Do not bend on your waist. I'm again telling you, you don't bend on your waist. Because if you bend on your waist, it will not affect you in the early days, but eventually in a month, in 10 days, in a week, you'll be broken up. Not only broken, it's not about broken, but you might get your back injured, which you might not realize. So always don't bend. raise the beds. Don't, if you feel like this thing is very heavy, no, you can always seek help. This patient cannot be. There are people who are very, very heavy. They can be transferred through these slider sheets. Or let's say the bed of this client got broken. Now he or she needs to get onto another bed. There's no ceiling lift in the room. These things happen. And that's true. I don't say those. Use a slider board. What we do, we bring both the beds at our level. Again, please be very mindful of what I'm saying. Lock the beds. Your bed should be locked. The bed should not move. That is for the safety of your client and for yourself. The first thing that you do when you enter into your client's room is you check, is the bed locked? Suppose you go in the client's
Like,
room.
excuse me, do we have to wear safety shoes at workplace? Like,
We do wear safety shoes, but normally those safety shoes are very, very heavy. We use proper, you know what, when we work in Fraser Health, they do tell us to use either North Face shoes or Nike shoes. They do have a, honestly, sponge. There is a gel, and if the gel will worn out, you won't be able to see. They recommend those shoes, not the steel toes,
okay, yeah.
because steel toes are very heavy. Steel toes are only meant to work in when we are working outside. When you, yes, if you are going on or with your clients to a place, just like I told you, I was working with Netflix, right? They were making movies. That time, I was not supposed to wear the shoes that I work at the hospital. You have to work with, you have to use steel toe shoes. So that's when you work outside. But when you're working inside facility, when you're working inside the hospital facility, community home, you need to use shoes, the lace shoes that have that gel, which will kind of take the stress. When you walk, you will see that it normally goes, not, it doesn't go, but it feels like it's going now. And then again, you can use inside soles just to make sure that it gives you more sponge, and it your knees, your heels do not take too much of stress.
Yeah.
This is all for our own self we need to do.
Yeah, thank you.
You're very welcome. So make sure when you go into your client, let's say I went in, I saw my client is dangling his or her legs, and I want to get her in. I try to move, the bed was not locked. The bed will slide. One, I might get myself hurt. Second, my client, he will fall off the bed. So make sure, safety check first. Safety check means bed locked, my client breathing, enough oxygen, bright light, and no scattered things in the way. If there are wires, tables, too many tables, too many things around, definitely you and your client both are at a risk. Both can fall, both can end up in disasters. So check your client's bed. Once you see that, oh, you know what, this bed, I don't know what happened. It is locked, but it's not moving properly. We need to kind of shift this patient from this bed to another bed. Not all beds and not all rooms have ceiling lift. In your facility, there will be, when you might be working, you would see there are 10 rooms. Out of 10 rooms, only 3 rooms have ceiling lift, because not all of your patients are on ceiling lift, and not all are meant to be have the same kind of room area and what we can say spaced. So some of them might be two beds in one room. Some they might be one bed in one room. Some four, and some might have a ceiling lift. So the bed that you are going to move the patient is not with a ceiling lift. The client was not very he's okay, but at this point is not able to move so nicely, or you have a new client in, you want to put them in the bed and it's not working. You would see there are slider boards, both beds at one place at your level, locked. Ask your client, can you please turn on one of the sides? So when they turn on the side, you get that plastic board, head side up, leg side down. We slide half on the one bed, half on another one. So what you do, try to push it under your client. Once you slide it a little bit in, it's just like when this is your client, turned, oh, I'm gonna slide this. When you put it, okay, can you go back on your, it will go like this. And then you don't pull your client, you and your partners pull the board. Once you pull the board, because they are at the same level, this client gets onto the other. Sometimes saying, I have seen instances when we had very bad days of COVID, things were being used everywhere, and it was once you use it with one patient or one client, you can't use it with another. And supplies were short. That's true. Not all the time. Everywhere supplies are available. That time, this is not somebody will tell you, but just because we are teaching, I'm teaching you, and you are all new to it. You know what you do? The bed, two beds at one place. There is a fitted sheet. When we go in the lab, you will understand what a fitted sheet means, but you might have seen it in your homes. You also have a fitted sheet, and then you have another sheet on your bed. So you pull the fitted sheet when your client is there, pull the fitted sheet from one bed to another bed when both are at the same level. And then you remove the fitted sheet from the patient underneath. That is when we had no supplies. We had to work like in olden days. That's how we do it. But we do not lift them. No matter what happens, no matter how critical it is, you don't lift on your back. Oh, you put your hand here and then I will lift. No. Always use walkers. Always use, there are belts that you put in. What you do is you have small, medium, large belts. You apply it on the waist. Make sure your hand it's locked properly, and then you would hold it. Then you don't lift your client. You hold him like this with this belt, and then while he's using the walker, we take them to the washroom. You do not lift anyone. And all this will involve your upper arms and your shoulder muscles, not your neck muscle. Not your neck, not your back. Definitely our neck and muscle is involved. It's only involved superficially, not for lifting purpose. Everything needs to be done by our big and heavy muscles. All activities require good body mechanics. Nowadays, things are getting very easy. We do have lifts where simply you ask your client to turn, the table goes under them, you lock it, and they hold on it, you move them. That's called a Golgo lift. It's very wonderful. And then you move that lift, just take them to the washroom. You don't have to tell them to get down. Right away, take those flaps away. It has buttons. He will be on the commode or she will be on the commode. Flaps in, things are getting easy. But if you don't use those, you want to lift, some people, oh, it's on that side, who will go? It's just a small way. Yes, it's a small distance. You will do it one day, you will do it 2 times, third time, you will not be able to move your back. So decide what is good for yourself as well. And also for the safety of your client. You do not put your client or your own self at a risk. Comfort and safety measures, protecting the skin, which is very important. Protect the client's skin during handling, moving, and transferring procedures. Please do not be very rough. They can get scratched, they can easily get bruised. So you have to be very, very careful while you're doing. If uh, some of them, they only have those gowns on, that means their back is open, they are not properly fixed at their back. You pull them with friction and shear, you will rip their skin off, because they're all the time in the facility. They don't eat, they're old, the skin is dry, the skin is dehydrated, and it's so thin, the fat under the skin is already gone. It's like the bone and paper. Their skin looks like that dry paper. So please do not move them roughly. Be very gentle all the time. If you see this client is dehydrated, you can always use moisturizing creams on them. Some of them are so good that in facilities and community homes, their families bring them specially nice and expensive creams. If they don't have it, the facility always has their own supplies, and that is free for anyone to be used. When it comes to comfort and safety measure, this is your client. Now, you yourself, you worked with 3 clients, and every time I work, you work, somebody else work. Okay, I went in, I did something, I go out, I need to use a hand sanitizer. Either I use a hand sanitizer or I wash my hands. What we do is after every 3 times we sanitize our hands, we wash our hands. But if you're just providing care to one client and you're performing different cares, you will use between that client, you will only use hand sanitizer. Saying, oh, I need to give her those books. I gave her the books. I don't know whether who touched them. Once the books are given, I want to start something else. Now I would put clothes on her. So with books, I might not have a glove on. Now, before I put the gloves on, I put some hand sanitizer. I put my gloves in, and I just want to I want to give her something. Something happened, I'm going to start another care. Oh, I need to feed her this. Feeding, while you're feeding, you have to remove the gloves. You cannot feed someone with the gloves. No matter what place you work, you cannot feed. That's not right. That's not good. So you will have to remove the gloves. Once you remove the gloves, you throw it in the garbage. Again, you hand sanitize. Every time you do something, you sanitize your hands for your safety. But at the same time, your skin gets dry. So there are creams that are meant for us as well. Use them. Wash your hands. Use them. That's it. The best way to use is every washing area has a cream and that dispenser and then soap. Once you get your hand under the soap, get your hand under the dispenser a little bit, mix both. When you wash, it will not take the moisture from your hands. It will take the moisture that you try to put from the dispenser. Your hand moisture would be safe. Then, when you dry your hands, either air dry or with tissue, apply a little bit on your hands, and that's it. Because if you have rough skin, you might hurt your client. If you have rough skin, it will hurt you. And at the same time, it might get ripped off. You might get at a risk of infections. If your skin is broken, if there are cuts, if they're dry, they're at a risk for infections. So, again, safety and comfort for you and for your clients. We do provide safe care when we are dealing with our clients. We make sure when we are dealing with our clients, we are providing safety, we are providing comfort, we are also helping them with their independence and dignity, protecting their rights, also protecting yourself. Reduce friction in sharing when moving the person in the bed, rolling or lift, ask them to roll on their sides. When you have to lift, that time, and when you have to roll, again, reduce friction. Simple. Use friction reducing devices, that is turning pads and slider boards. Slider board is a very nice thing to be used. It's like a plastic thick board that we use. Yes, it is a little bit heavier, but it's safe for you and your client. Check with your supervisor or your client care plan about limits and restrictions in positioning. But slider board is only required when your client is not able to move. If your client is all semi-independent, can turn on his back or on her back, we do not use slider boards. We use sliding sheets, which is every client should have. Again, that would be one of the safety check that your client or your resident or your patient, wherever you work, has a sliding sheet. Or there's a soaker pad and a slider sheet. Those two things should be under your client. Soaker pad is, what if this client became too wet, the whole bed and the whole bedding you don't have to change. It is a good thing for you. Those will get wet, but that wetness would not go over and under the other. It's like a huge thing. Soaker pad, you put those. There are two types. One is disposable, where it is used and thrown every day. The other one is, if it's wet, needs to be changed, cloth one, and washed. Before, I think they were using the washed one. Some are very advanced. They are using again the use and throw one. Some still are going back on washing once. Every client resident has a care plan. Every person has a care plan. Again, care plan tells you about mobility of the patient. Care plan is, it's just a gist of what the patient looks like to you, who the person is, how you need to assist him or her with mobility, with feeding, with changing. Are there any dressings? That's all. No dressings, shower, yes, no, when. Everything is written in patient's care plan. Comfort and safety. Decide how to move the client and how much help do you need. You went inside a room, you saw, I feel like I can move this patient off my own. Might press the call bell. Somebody else will also come. Hey, this client is very heavy. Would you mind helping me out? Both of you use the slider sheet, pull them out. Or it's not always there in the bed. I need to get her in the chair. Use hold the walker. You give directions to your client. The other one, once you have put that belt around the client's waist, will hold so that you don't have to lift the client. And then you give direction. Oh, move your leg, turn around, turn on your right side. The other person will pull the chair in. Okay, scooch your bum. They go in. Always ask and see who and who's the first client I should do, who should be my last client. So time management should be your critical thinking. Do I do the heaviest person? If I did the heaviest one first, all my other clients who need minor assistance will be left undone. Nobody amongst them would be on a dining table. Why don't I do all my independent ones? Okay, let's go out. You need to wear this. Who are very independent, who just need verbal assistance. You help them first. Second, one person assist, minimum assistance. Okay, this I'm holding your sweater, jacket, or your shirt. Let's put that in. I'm gonna hold your hand. Sit up, dangle your legs. Don't ask them to get right away out of the bed. Always make them sit at the edge of the bed, dangle their legs, stand up at the count of 1, 2, 3. They stand up. Again, sit down, then ask them to go. That's because they are being in the bed for a long time. If you, even yourself, this should be a safety thing that you do with your kids, with yourself, with your family. Don't get up right away from out of the bed. You can get dizziness, you can get a syncope attack because we are lying in the bed. The blood is at stasis, it's not moving so fast. Suddenly we come out of the, we rush. That's why we fall, because our body, our brain cannot progress that we rushed and where the blood has to flow, which organ right away. So all the blood is going towards our legs because we are running. The brain does not get enough blood, enough oxygen. We end up dizzy, we end up in a fall. So once you tell them, stand up, it goes, sit down right away. It balances, it understands something has to go to the legs, some has to go to the brain, and then second time. If your client is confused, or if your client is not in a position to do it, is not very, you can say, compliant with the care, doesn't want to do it, one time I'm done, that's it. Ask them to sit at the edge of the bed, dangle their legs. While they dangle, it means the blood is going towards their legs. They're getting stabilized, their legs. Then you tell them, put your feet on the ground. Do not lift your, make sure they have that non-skid shoes on, this non-skid socks and shoes, both on. Think of yourself. Nowadays it's winter time. Even if it's a wooden flooring, it is cold. If they don't have a socks on, they put their feet up, they might lift, they might fall because you're lifting your feet up. They don't have that balance anymore that they can stand and balance on one feet. So making sure before they get out of the bed, they sit at the edge of the bed, the socks, non-skid socks are on, if necessary, the shoes are on, and then they move. That's how it is. Communicate, decide before moving the client who will count. Yes, that's why I said there are always two people, and between the two of you, make sure you tell your partner, are you going to count or I will count? And you tell them on the count of 3, 1, 2, 3, get up. So when you say 3, they would get up. Okay? We don't just move them without even notifying. No. Providing safety, move the client in small increments. Yes, protect tubes or drainage containers. Some of your clients may have Foley's, some may have suprapubic catheters, some may have colostomies, some may have these NGs. So when you're moving, to make sure some may have only oxygen tubes. So please make sure when you're moving them, now they were sitting in a chair and you put them in the bed. When you put them in the bed, make sure the tubing is not blocked because you put them in the bed. The tubing went underneath the client's back and he's leaning on it. Would he be able to get oxygen? No. Is it that if there's a fluid running in, it can go through? No. You are blocking it. or you might pull it, because if it's an NG, that NG needs to be secured with the tape, and then we secured it with the patient's clothes. When I'm changing the client, I did not open the pin. I just tried to take it up. I'm ripping her NG. If you're not in the hospital, if you're in a residential home or a community home, my dear, remember, this is gonna lengthen your work. This is gonna be a PSLS. PSLS means it will be a complaint to your manager. Why? Because there in hospitals we do it every 5 minutes. But when it is your residential home, when an NG is put in, before and after we have to do an X-ray. The patient needs to be NPO, nothing by mouth. NPO means nothing by mouth. He should be empty, because when you're putting a tube, they might throw up. If there's food in their stomach, in their esophagus, you won't be able to do. It has to go through the nose, through the airway, back of the airway. Then once it's in, we are just doing a blind thing. So we again need to do an X-ray. That means he or she needs to go to the hospital now. You have to pay for the transport. Somebody needs to go with them. Then again, you don't know how they will do. You will have to stay. So this is going to lengthen your work too much. That's why protecting tubes and drainage containers is very, very important. You're changing the clothes. Make sure, are you putting diaper on them? Make sure that the pulley is not being ripped. You're giving a shower. When you check, it's a leg bag. It should have a velcros, and it is again attached back to the client's leg. If it's a night and or a day bag, we will see all those things that you will be using. You have to get familiar with all these things, making sure they're hanging on the side of the bed so that the length is not that too far. It is not being pulled out. Position the client in a good body alignment after moving. If they are sitting in the bed, make sure they're up. There is a way when they are lying flat, a little bit head up. If it's more than 30 to 45 degrees, we say the patient is in high follows position. When the patient is sitting like this, upright. If it's a little bit back, semi-follows position. So this is what you use. These words you will be using. Followers, high follower, semi-follower, you will use these words to sit up your client. Leave the client in a wrinkle-free environment. Saying wrinkle-free environment, when you put your client on a chair in a bed, make sure the soaker pad, the sliding sheet, the client's bed sheet is not wrinkled. If they are wearing clothes, they are being pulled properly down, because they will be lying there. They might not be able to reposition on their own. This wrinkle will stay till somebody will come and move them. It might cause itchiness, it might scratch, it might cause redness, and it might not be comfortable. Okay. Assistive devices. Please use all your assistive devices that you have available in your facility or your nursing homes. Turning pads, again, I said we don't say turning pads, we say they are soaker pads and these moving pads. Mechanical lifts, which is very important. Before you put you move your client on a mechanical lift, use your brain box, saying your client is small and you used a big sling. What do you mean by sling? Mechanical lift is a lift that is like a hook like this, and we have to put our client in a hook. So we put a client in a net. This net is called a sling. Your client is this much and you use the extra large sling. They might slip out of it, because with this mechanical lift, you will move him from this side to this side area while they are holding the lift in the lift, they would be holding the side. If your sling is too big or too small, if it's too small, it might not hold. If it's too large, they might slip out. So making sure when you're using a mechanical lift, you are using a proper size sling. Sling has grooves. Make sure you put all the 3 grooves inside the lift. If you put one, sometimes the groove will come out. It's like those grooves. This hook is called a groove. They are small, then the other one will be like this, the other one. Sometimes we are in a rush, we only put the top one. If we put all the 3, it cannot come out from the hook. But if you put only one, this one can slide out, your client can fall. And that fall will be not because of the client, that fall will be because of you, your mismanagement. So making sure when we go in the lab, I will show all those things, but you need to know. You need to ask yourself, you need to use your own judgment. Oh, even if your partner does not want to use all the 3 grooves, you use it. Oh, are we putting it in a blue one, red one, or gray? It's standard. The 3 colors are standard. No matter where you work, they're standard colors. Let's put them in the gray one. The gray one is the largest one, the outside one. Okay, while you are about to turn, this client moved, the groove came out of that thing, and done. He's on the floor. Thank you very much. Done. So that's why you need to decide what you are doing. When you're using a lift, mechanical lift, one will watch while he's hanging and holding the sling. The other one will move, and the other one would just keep. That's why we sometimes need 2 or 3 people, always using a mechanical lift. With a ceiling lift, again, you use a sling. One will move the remote, the other one will hold the sling of the sliding, and the other one will push him down. Okay, wait, pull, down, down, down. You exactly put them in a proper position and they set down. Then you don't have to lift them. No lift policy indicates which client must use it. Yes, not all your clients can be using a mechanical lift. Some of them might use sit to stand lift. Some of them might use ceiling lift. Some of them might use Sarah Steady. Sarah Steady means they're just okay, step on this, they step on it, and the lift will close, and they have to stand. You move them. It's just an automatic one. But no lifting. You do not lift. Though we are lifting them, but we are not using our body, we're using all these machines, and they're all operated by brain and electric. If you are using a ceiling lift, it is you to make sure your ceiling lift is locked down back into the groove where it is charging. If it's not charged properly, if the battery is low, while you put them up in the air, they're about to move, they will fall. It's your fault. So please be mindful. When I use a lift, I put it back on charging. It doesn't matter, I'm not going to use it again. My friend, my other co-worker has to use it. If it's not there, if it's not charged, can someone use? No. So our responsibility would be docking it in and making sure it's been charged properly. That's what our role should be. That's what we are going to do and how we work. This is a piece of work that we say interprofessional help. This is how we do teamwork, making sure things are ready for my next co-worker. Your co-worker makes sure things are ready for you. And you will see in again saying care plan is what you follow. You will see what would be in the care plan, which lift to use. Might not be using lift, might only be using a walker, a cane, a two-wheel walker, four-wheel walker. Oh, sorry. Moving the client up in bed. The client is moved up in bed for good alignment and support. Check agency caregiving lifting programs and know the policy for moving clients. Clients may have trapeze to add to aid with moving. Yes, on their bed, you will see like this. This is called a trapeze. It is hanging on there. It's just that they might have gone through a surgery, a fracture, or they might not be able to move properly just because of some disability. They hang on that trapeze on with one hand and then they move. So that's when it is. Having someone help you protects you and the client from injury. This is definitely, if you have extra help, if you ask for help, it will not be too much burden on your client moving and on you moving the client independently. So it will be safe job. This is what I'm saying. When you ask, make sure the pillow is out. You don't put it on the bed. This is, you're using a slider sheet. The thing here that she's holding on, this is slider sheet. Always they are hanging on the side. So you hold on this slider sheet, ask here, ask your client, can you please bend your knees? Once we would say on the count of 1, 2, 3, you will push with your knees up, and you don't leave your bed like this. You will put the bed in a sliding position. Sliding position will allow again the client for an easy slide. No friction, no shearing. Am I clear? Everybody's okay? Huh? All good?
Yes.
No boring? Everything's fine? So please make sure these things are very, very important. These things are the things that you need to look at. Suppose this client that you have here, you did not use, see, they're folding the slider sheet. I would again tell you, now when you're changing your patient, you need to roll the slider sheet in, and again, the new one that you put in, roll it first. That way, what happens is, if you roll too much, tell your client, you know what, Mr. Smith, you will feel a bump right now in your back. We have rolled it down. Then, now turn on my side. You only have to unroll it. This will help you saving time. You don't have to turn back and forth, back and forth. Make sure you put enough on one side and it's rolled, so that you don't have to pull from this, now this, because when it's properly rolled, he turned on one side, it went under his back, now he's turning on your side, you only have to unroll, which is very easy, comfort for you, less work for you and your client. It's all your judgment, it's all your critical thinking, how you will plan. If you plan and you don't know how you're doing things, you will put it half through, then again turn, then you will be stuck till 12 o'clock in one client's room. You will never come out of one room. So please be very mindful. Remove the pillow, put it on a chair, ask your client to go up. When we pull them up, then once we put the head up, they might slide a little bit. Put the feet up. If the bed doesn't have the thing, putting the feet up, get a pillow, put it under the legs. Once you put them under the legs, they cannot slide down because the pillow is having a cover. The cover does not slide. So your patient would not slide easily down when you're sitting them up. This is what we say a turning pad. And then see, this is how this turning pad from one, the lady who is right now in this is called, it's not a bed, This is called a stretcher bed. So when somebody comes to you and you have to move them from a stretcher bed to the bed where she needs to go proper bed, you use this slider turning pad slider sheet that I mentioned earlier. Or if ever this is not available, you put a slider board, both beds at one level, at your waist level, not at the client's waist level. And making sure, sometimes what we do, we just simply go on this side, it's up, ask them, and pull. You don't do off your own. Ask for help. Turning pad is also known as sliding sheet, slider pads. We don't use turning pad, we don't use the word turning pad, slider pad. We always use slider sheets. Sliding sheets we use, it should be mandatory. When I work, when you work, when somebody works, if I get into an injury and I call WorkSafe BC for covering, they would say, "Did you use a turning slider sheet?" No. Why? Our facility does not have it. But if your facility has it and you haven't used, okay, they will put that thing note. I'm so sorry, my dear. Just because you haven't used the proper policy, you haven't followed the policy of your workplace, we cannot cover you. What was the thing that you did not use? Slider sheet. That's what the answer was. Yes, I use the slider sheet. I use body mechanics. I was wearing the proper work shoes. Okay, I'm so sorry you had this. We'll get connected. You will get paid off for the days you were off, or you're getting off, or if you need sick time. Your sick time will not be used. Your sick time will be like that. And you're not working, but you're getting paid. You need a physio? Okay, I'm burnt out. I want to call out sick, but you still get paid. But if you don't do these things, you will not be covered. Sliders have replaced turning pads in many facilities. I already told you these are being now changed. We do have proper sliding sheets in the residential cares in facilities, which we do. Sliders are used to move the patient, the clients up and down and for reposition. When you reposition, you don't hang on their arms, you don't pull their clothes, you always make sure you pull the sliding sheets up. Rolling versus log rolling in a client of a client. Log roll means clients with back or spinal surgeries often need to keep their spinal column in straight alignment to prevent further injuries. Clients need to be rolled in one unit. And how do we use it? How do we do it in one unit? Right away, using slider board, not sliding sheet. When somebody has spinal injuries, you don't use transfer sheets, slider sheets. You always use slider board. Rolling. Clients who do not have severe neck, back, or spinal injuries may be turned or they may be rolled. You tell them, can you turn on my partner's side? Now roll on my side, and that's how you do it. Turning the clients are turned onto their sides to help prevent complications from bed rest. If your client is in one position all the time, is he or she is lying on the back, just it will cause backache, second bed sores, ulcers, and the other thing is that will rip their skin off. Might be they have redness on their skin. For certain procedures and care meshes, yes, sometimes there are problems that people have, clients have. They have to go for a procedure. For that procedure, they might be in one position, but otherwise, not mandatory. It will be a back side. Sometimes, um, just like pregnant ladies, they should be lying on their right side, just so that they're not short of breath. Some people, they are paralyzed. They can go on their right side. So that doesn't mean they will be always on left side. No, either on the left side, either on the back. Sometimes there, sometimes here. Support them with pillows, support them with rolls. Where we will get those rolls, we might have to make them off our own. We get the sheets, we get the towels, we make small rolls, and that's how we protect them. The client is turned towards you or away from you. Hey, Mr. Smith, can you turn on to my side? Now turn on to my partner's side. Turn on to that side. If it's only one person, you and the client, turn on to me, my side. Now turn on the other side. So that's how you give them directions to what you are going to do. When you are turning, also make sure privacy, you're providing privacy. You do not turn them while the curtains are not on, while the door is not closed. Again, confidentiality, privacy is very, very important. Otherwise, you'll say, oh, how does it matter? I'm just turning. It doesn't matter for us, I'm just turning, but it does matter for the client. So while you are turning your client, still your curtain should be on or the doors should be closed based on in what situation you are in. Provide safety, privacy, confidentiality all the time. Promote it. There is no second chance for anything that you would be given an excuse for. After the client is turned, position the client in a good alignment. When the patient has turned, when he has gone in on the back side, make sure he's up as well. Now, when he's up, put the head a little bit up with a pillow or the bed up slightly so that it would be easy for them to lay for next couple of hours in that position. Use pillows for support. We also use pillows not only for neck, but for the arms. If they are teeny tiny, they might slide into the bed. We support them with pillows so that they don't fall off from the top to the bottom, from side to roll on sides. So we support them with pillows. Let's say the client, he or she has heavy legs, has DVT, varicose veins, and all those things. You always make sure heels are dry, there is dressing on the leg. So we support those things with pillows. We put pillows under their leg. If we don't have extra pillows, get a sheet, get a towel, roll it, put it under the leg so that your client's legs, feet are already offloaded. They're off the bed. They're not touching the bed. That's when, if they have redness on their ankle, if they have redness on their heel, it will not end up with a bed sore. Moving the client from a bed to a stretcher. Stretchers are used to support transport clients who cannot sit up. I told you, this is what we say not all the time in hospitals or in your residential homes. Your clients will be in a proper bed. They will be in stretcher beds. There are also beds. They also have, they can move. But the difference between a stretcher bed and a proper bed is a proper bed has air mattress. This does not have air mattress. The mattress is very thin. It's not comfortable for the back. When you sit on or sleep on a stretcher bed, it's not comfortable. It's not strong enough to support the back. It gives you backache. Stretchers are used to transport clients who cannot sit up, must stay in the lying position, are seriously ill, waiting for the hospitalist to see. The other name for doctor is hospitalist, waiting for the hospitalist to see, waiting for transfers, needs to go from facility to hospital, from hospital to facility. So we put them, we make sure that they are lying in the stretcher bed. They will ask you, we say SNT. SNT is a group of people who move people from home, facilities, hospitals, from one place to another place. So once you would see an SNT, group of SNT like transfer coming in, they would ask you, is the patient going on a stretcher bed or on a wheelchair? The difference again between the stretcher bed is that it's not a proper bed. It does not have a heavy mattress, an air mattress. It has a mattress which is thin. That's why it cannot support. If you're lying in that, you will have, like the client will have a lot of discomfort for a very long time, not just for short purpose, an hour, 2 hour, 5 hours, but more than that, it's not recommended to be there. They're waiting for or returning from surgery. When we do when a patient goes for a surgery, we don't do surgeries on proper beds. We do it on stretcher beds. Then they are on the stretcher bed, new fitted sheet in, everything clean. They're waiting on it to go into their room. So that's when they are on those things. The stretcher is covered with a folded flat sheet. We don't say folded flat sheet. We call it as a fitted sheet. A slider board is generally used. Yes, if they came across a surgery, we do not use other things. We use a slider board. At least 3 staff members are needed for safe transfer. I mentioned earlier also, for a slider board, minimum 3 people. Minimum. Two on one side, one on one side, but normally we don't even do 3. We always do more than 4 people. If you don't call out for your help, it's you. Unfortunately, it's you who made that mistake. Again, you're not covered for your fault. Safety straps are used. Safety strap means that you use belts, safety belts. You use a lap belt, you use a turning belt. They're always use the proper, please and please use proper size ones. For a teeny tiny person, do not use a big one, a large one, a medium one. We do have very small. We have, it says very small, small, small and a very small are different. So use your judgment which one I need to use. Even for blood pressure cups, we do also have very small. So you cannot take a blood pressure of a huge lady with normal one. No. While you put it on, if you are blowing it up, it will open. So always make sure that when you're using equipments, you are using the proper size equipment. You are using, you see the expiry, you see it is charged, uncharged. Make sure these things you are paying attention to. Oh, I didn't realize I put the client on the lift, but now the lift is suddenly stopped just because it was not charged. I did not pay attention to. Before I make sure I move the patient, I might ask the client, Mrs. Smith, this is not charged. We'll be moving out of the bed or from chair to the bed in a while. Let me put this one on charge. Be safe than sorry, because your sorry can turn out to be very dangerous. Okay. The stretcher is moved feet first. Before we talk about the stretcher, again, it also has brakes. Make sure the brakes are always on. Your patient wants to turn on right side, the bed also moved, they roll down. If the bed is not secured properly, if it's not locked. So lock the bed, please and please. When you go into your clients, even if it's not your client, you see the patient wants to turn, the bed kind of is moving, go and check on the one time. Go inside, unlock the bed, then again put the brakes on. So the brake should be on all the time on the bed. Imagine a wobbly bed, you turning on a wobbly bed. What would happen? While you turn, the bed turns, you will fall. So you always have to think of how it would be if I am there. Sympathy and empathy. Keeping your own personal self in your client's position. What would I do if it was my loved ones? What would I request and think of getting for them? So that's what we do. The staff member at the head of the stretcher can watch the client's breathing in color. If your client or your resident or your patient is not doing very well, one of the co-workers needs to keep an eye on your client, breathing, facial expression while you're moving, just to know, is the patient getting too much discomfort? If we are moving, some clients, they have, let's say, fracture, neck fracture. They don't have to move at all. But just because she's tired in one position, what would you do? One of your co-workers will hold the head, the other two will roll the client on. We don't use transfer sheet for them. We use this board, slider board. Then holding the neck like this, one holds the neck like this, the other slides the board in, and the next one moving the body. That's how we do. So we always work as a team. We never work of our own. It's always we have help. If we don't have help, we always call for help. Hey, I'm going in bed or room one. Can I please have your help? Okay, if you're busy or your co-worker is busy, I'll be there in 5 minutes. Give me some time. So that's when you and your co-worker decides what time. Sometimes you will tell them, I have a client who is a bit heavy or does not is not compliant with care. Let's go together in this client. I might help you with your client in this bed. You help me, I help you. It's like give and take. Okay, never leave the client unattended on a stretcher. When your client is in a bed, when your client is on a stretcher, make sure the side rails are up, because these are very narrow beds. These are very narrow, what is it called, a stretcher bed. If they turn, they don't realize they're not in home. Dum! You hear it, and they're on the floor. So make sure side rails are up. And if it's not a cognitive patient, one side rail down, because they might climb over the side rail when they're coming out. And that also can be dangerous, which is a restraint. Always only one side rail, one of the side rails should be completely up, on the other should be down. If it's a proper bed, you will put head side rails up, both sides, foot side rail on one side. Out of 4, 3 up, 1 down. That's standard. Am I clear? Each bed has 4, which is a proper 4 side rails, 2 head side rails, and 1 foot one up. The other one should be open, a chance for them to come out of the bed. Otherwise, they might not realize. They climb over the side rail, and while they're climbing out, first they hit their elbow, then they hit their head, then they hit the floor. Eventually, it's not all the time. You will come and witness the fall. It can be a witnessed or an unwitnessed fall. Somebody else comes and witness. All the side rails were up, because once there is a fall, you have to report. You have to fill in an incidence report. Incidence report says how the patient was, what patient looked like, what the surroundings look like, what you did, what the client said he or she is doing, or if there's blood, was the client on the face, on the side, how was she or he lying, how did you assist, did he hit his head, did you saw him hitting the head. So all that goes in the incidents report. So they would say all side rails up. Did you have a permission to put all side rails up? No. Why did you do that? Thank you very much. If you do it again, we might not keep you in our system. So make sure you already have 3 side rail up, which is general, everywhere the same. Okay? The client is moved to the side of the bed for repositioning for care procedures. Before turning, to limit the need to reach out the client, ask them to dangle their legs. It's not only every time you ask your client to come out of the bed or from a chair to the bed, ask them to dangle your legs. This is mandatory. You're sitting with me for a long time, dangle your legs. You're sitting in a plane. Always, if you're going for a travel, you're sitting in a plane, dangle your legs and then move your fingers. There's not pull, we call it pooling of blood. Blood does not stay at one place, it keeps on moving. That's why when you go in a flight and you just don't dangle your legs, you will see your feet will be swollen. Have you seen our feet? Why? Because we did not dangle our legs. All the blood and all the fluid went into the legs in one position. That's why it's very important for us to move. It's not that move means roam in the hallway of the aeroplane. No, dangle your legs, move your fingers inside. Put fingers, toes and hands. That requires when you do a movement, for each movement, blood has to flow. So it does not stay at one place. That's when you do not have edema. This is going to prevent edema in your clients. This is going to prevent edema for you. Because getting out of the bed too fast can make clients dizzy or faint, the clients need to sit for 1 to 5 minutes first. So what you do, hey, Mrs. Smith, we are getting out of the bed. Can you please sit at the edge of the bed? Let them sit on the count of 1, 2, 3, you will stand up, dangle your legs, and then you will sit back. That's what they do. They follow commands. And if you think they're not following commands, let them sit, let them dangle your legs, show them what to do. Follow these guidelines to safely position a client. These guidelines should be followed all the time. It's also for your own safety. When you are sitting in a chair, when you're sitting somewhere where you're not moving, dangle your legs. This is very important. It prevents edema. It prevents swelling. Ask a co-worker to help you if needed. Explain the procedure to the client. Be gentle when moving the client and provide client privacy. No matter what you do, provide privacy. Use pillows as directed by the nurse for support and alignment. If your client needs to, let's say he is right-sided weakness, under the right side, that means he is not able to move his or her right side too much, or might not completely be able to move. Under the right arm, put a pillow. That's when you put a raise. If the arm is raised up, you might not get. If this is not raised properly, if it's not offloaded with a pillow, might be it gets swollen, it gets ulcers, all those things. And if you don't know, you can always ask your nurse, hey, you don't have a co-worker, it's you and your nurses. One of you, can you please give me a hand with this client? You always ask. Provide for comfort after. Yes, when you're positioning someone, after that, make him comfortable. Get a warm blanket. Put the warm blanket on. Put a pillow under him. Put the head up. So if you change the client, you position him, you remove the blanket, now you will get, do you think a cold blanket should work? No. Try to get a warm blanket and then put that under, then put the other ones, the regular ones, so that they feel comfortable. They feel they're being taken care of. Place the call bell within reach. Yes, all the time you place the call bell under the reach. If it's been, and you have to make sure it's plugged in the wall as well, it's working. If your, let's say, patient or your client cannot reach the client, get a pin and attach it to the pillow. So this is what is meant for you to know how I plan. If I am planning my trip to Hawaii, what things, clothes do I need to take? It's the same thing. You're going to Hawaii, you have your client. What do I do with it? How do I plan? Who do I feed first? Who do I reposition first? If I'm providing care, I'm giving care to them. Who's the first one? Who's my last one? Complete a safety check before leaving the room. Side rail up, bed in the lowest position back. Again, now, because you were providing care, what is safety check? You provided care. I mentioned put the bed up in at your waistline, and you left. You did not put the bed down. And client normally goes out of the bed. He cannot reach the ground. He falls down. So after you provided care, make sure it's all in the lowest position again. So those are safety checks that you do. Brakes on, side rail up, bed at the lowest position, those things. Call bell in reach. This is what you do. This is your safety check. It's a standard safety check for everyone. It's you need to follow it. Okay? Sitting on a side of the bed, dangling the legs. While dangling the leg, the clients cough and deep breathes, move the legs back and forth in circles. Two staff members may be needed, client with balance and coordination problems. If your client is not having a stable gait, is not stable, again, it can be a two-person assist. Not mandatory that it would be one-person assist. If dizziness or fainting occurs, lay the client down. If your client says, hey, I'm just dizzy, I'm not feeling well, okay, my dear, no worries, let's put you down, let's go back, let's lie down, allow that. Put a pillow and report it to your nurse. Hey, the client says, I'm not feeling good, I'm feeling dizzy, does not want to sit up for breakfast, does not want to be in the chair. She's lying in the bed. And before you go to report it to your nurse, make sure you give them in hand. Put the call bell in hand. If you don't feel good, something goes wrong, press the call bell. This is what and how you plan. Because, oh, I will go and report it, but you did not give the call bell in hand. She's not feeling well, she might not be able to reach. So you give them in hand, say, hey, meanwhile, I will get back to you, or I would report it to your nurse. I want you to press the call bell if needed. That's what you do. Report observations, pulse, respiration, skin color, complaints of dizziness, lightheadedness, difficulty breathing, how well the activity was tolerated, amount of help needed, and length of the time. The client while the client is dangling, oh, you would, and she says, I'm not feeling well. You would report to the nurse. Hey, while I was about to move the client, the then what happened? I went to school. You're not going today just because you'll go to shopping with Bob. It is early dismissal today. It's early dismissal today. That's why I did not wake you up. You will go with Baba for shopping. Okay, put on your clothes and let me drop you off. You'll be back in 1 hour. Okay? Go back to the bed, you'll go with Baba for shopping. Thank you much. So you would report if the patient was, if your client was, you can say, flushed skin, the patient was using pursed lip breathing. This is how we say pursed lip breathing. Respiration, he was tachy, it was fast. We could see. So those are the things that you will have to report. Was respiration okay, normal? Was it tachy? Was he using pursed lip breathing? Was he flushed? Was he feeling weak? How was the skin? Oh, he was precipitating. You had a lot of sweat. So those are all your observations you might report it to your nurse. Positioning the client. A client must be properly positioned at all times. Yes. Regular position changes and good alignments promote comfort and well-being. Make breathing easier. Put the head up. Make sure that the client is able to promote circulation. Feet up. Elevate the feet all the time when they're in the bed. Help prevent complications, pressure ulcers, and contractures. If that person needs to sit in the chair, you can always put a pillow at the back. If he's is lying on the back or on the side in the bed, please tug in those pillows and support them with pillows, rollers. Some clients need a reminder to change their own position. Some of them, they are able to move off their own. You don't have to, but you only have to remind them. Hey, Mr. Smith, turn into turn in the bed. Just it will promote. If you see he's still lying on the right side while I left, you came after now. Why don't you turn on your right side? Now, why don't you turn on your left side? So just a reminder only, not mandatory that you have to push and pull them. Just because it's others depend entirely on healthcare. Some might be able to position themselves, some might not be. Some might need reminders to do things quite a number of times. Whether in bed or chair, the client is repositioned at least every 2 hours. The minimum a client needs to sit in one place, whether in a chair or in a bed, is 2 hours. Every 2 hours, it is standard to reposition them. That does not mean put them in bed for after 2 hours and now put them in the chair. No. Repositioning means they're sitting in the chair like this. Now, would you mind sitting up? Okay, lean forward. I'll put this pillow underneath. Okay, lean on your right side, lean on your left side. That's what repositioning means. Follow your supervisor's instructions and the care plan. Physicians may also order the limits of repositioning. It is your, sometimes not, they are not able to reposition too much. This client has a slip disc, has a fracture in her ribs. So you might not sit them proper up. Your physician will tell you how to move the patient. You have limits for them to get position. So follow those positions. Always leave the client in a good body alignment. Observe the client for the signs of redness. Could be paling. The skin looks pale yellow. Discoloration means blue, just because it's cyanosed or it's bruised. Sometimes you will see your client's hands are blue, they are cyanosed. The nose is blue, it's cyanode. It means if the patient is having heart issues, myocardial infarction, heart attack, it's a sign of patient getting heart attack. If the nose is cold and if the nose is cyanosed, that means there's something wrong with the heart. So always immediately report those things. Before you report, keep your patient safe, call bell in hand, in the lowest position, privacy given. That's what you do. Take a break. Let's get back in half an hour. Not half an hour, 45. We'll come back at 11. How is that? Okay. Everyone good? Let's
Yeah,
do it.
that's
Okay, my dear. Are we back? Everyone is back? Have 4 minutes to come up. Okay, everyone is back? How about you, Nima? Are you there? We don't see you. What's wrong?
My camera, I already texted you my camera on the laptop is not working.
Okay, no worries. I didn't get it. It's okay.
I'm back.
So everyone is here. Let's go back. Is the screen again there? Can you see the screen, comfort and safety measures?
No.
No? Okay, I'll share it again. I don't know what you guys were able to see. Let's do that. Share screen. Which one was I sharing? I think I'm sharing this one, right? Yes. So we are back on comfort and safety measures. Right? Is that right, everyone?
Yes, we can see it now.
Okay. So we did talk about this one. Types of positions. So Fowler's position, as I was saying, in Fowler's we have semi, high, and low Fowler's. High Fowler's are a semi-sitting position. The head of the bed is raised to 45 to 90. 90 is completely your patient is sitting up. We call 90 degrees sitting up position. The knees may be slightly elevated. Semi-Fowler's, the patient's head is between 30 to 45 degrees, and low Fowler's, it's just slightly between 15 to 30. Saying low Fowler's would be around 2 pillows. Semi-Fowler's is around, if you put 3.5 pillows, the head so much up the bed. And high Fowler's is somehow not 90 more than 45. 90 is also high Fowler's position, but 90 is when we say the patient is sitting up in upright position. So clients, they're confirmed those who are, let's say, clients with shortness of breath, you might put them in high Fowler's. Patients with asthma and COPD, when you see, you might put them in high Fowler's position. If patient is gonna eat and you're setting the patient up in the bed for breakfast, lunch, or dinner, you might put them in high fallers position. That's when we put them in high fallers. Semi-fallers is somehow meant to be relaxing mode, and low fallers is when you want your clients to be sleeping in bed. Clients confirmed to bed use these three positions for eating, visiting, watching TV, and reading. Use pillows for support. When you put them in any of the three positions, you might see your patient slides off the bed. When they're up, they keep on going, sliding down. So just to prevent that sliding down off the bed from the top, we always support them with pillows. Maintain a good body alignment, which is very important. Ask them to open up their legs between the two legs. Put a pillow so that once yours one bone or one leg sits on the other leg for hours and hours, it might also cause skin breakdown. So between the two legs, put a blanket or normally we put a pillow, but if we are short of pillows, then we might use other sources like blankets. Otherwise, always support your clients with pillows. Make sure the feet are offloaded, the heels are offloaded. Use pillows always. Encourage the client to reposition. Hey, Mrs. Smith, you can now or later turn on your right side. Remind them based on how they position. What's there? See, these are what it says. Let me make it bigger. So this is when it says 0 degrees, this is 15, low fallers between this semi-fallers and high faller position. And this 90 that you see here that we are seeing, this one would be 90 degrees sitting up, upright position. This is called upright position. Types of positioning. People on slide C, when he's on sleeping and one leg is falling on the other one, you put a pillow between one arm on the other arm, you put a pillow in between. If they are sleeping face down, you put pillows like this. It's very, very important to support them with pillows. Same at the back to prevent bed sores. Types of positioning. Sitting position. Clients who sit in chair must hold their upper bodies and head erect. Yes, you sit straight. You do not lean. Do not lean. Leaning will make you fall. Leaning causes contractures. If you see your client needs support and he might lean on, get the breakfast table. Support the patient with that client with that support table. Feet are flat on the ground or on the wheelchair foot plates. I told you if they are on the wheelchair, please make sure that the foot plates are always locked in and they're locked. Backs of knees and calves are slightly away from the edge of the steel. They're not on the steel. It might cause skin breakdown. The nurse may ask you to put a small pillow between the client's lower leg and the chair. Yes, we always ask. A pillow is not used behind the back if restraints are used. If you are restraining a patient, restraining means if you are putting a lap belt, the other name for lap belt is also safety belt. If you are putting that safety belt on the client because he is a wanderer, can you stop moving your feet, please? So if ever your client is always a wanderer and is not redirectable, so you are trying to put a restraint on, make sure there should be no pillow. Otherwise, the pillow might move. They might be able to pull that pillow and the restraint will no longer act as a restraint. Always restraint before restraint, nothing on the bed or a chair. Client and the bed, client and the chair. Some clients require postural support if they cannot keep their body erect. They might need these. They might, sometimes what happens is, let's say your patient, your client is all good, no problem, but he or she is getting feed or IV, and she wants to relax. During sleeping, we don't know how we behave, right? And she's folding her arm every 5 minutes, and the lattice pump, it starts to beep, beep, beep. A patient's arm occluded. So what do you do? The patient says, I'm so tired. I just want to sleep. Can you please restrain my arm? So you put a soft restraint just to support the arm straight. And when it's already tagged in with something straight, he or she might not pull. That's what it is talking about. Supporting the arm during having an IV and the patient wants to sleep is cognitive, has a Foley, but she keeps on moving and the Foley might rip off. So they tell you, oh, can you put my leg like that? Support paralyzed arms, and yes, we always support affected arm, affected leg, paralyzed arm, paralyzed leg with pillows. I told you already. This is the sitting upright position the way we need to. Repositioning the client in a chair or a wheelchair. For good alignment and safety, the client's back and buttock must be against the back of the chair, just like this. The buttocks and the back and the chair. So you always, if your client is not sitting in this position, you can always tell them, hey, Mrs. Smith, can you scooch back so that you sit upright, and they would sit upright. Follow the nurse's direction and the care plan for the best way to reposition a client in a chair or in a wheelchair. We always ask the nurse, oh, do you want her to sit up in the chair, or do you want her up in a bed? The way they want, you do it like that. Lock wheelchair wheels. Again, when they are in the wheelchair, please make sure they're locked. The locks are at the front, because if they try to move or reach out to something, they might fall over. Otherwise, if it's not locked. Use transfer belt for a secure hold on the client. Yes. If no transfer belt, put your arms around the client's arms and place your hands around the client's shoulder. Normally, we don't do it. No. If there's no transfer belt, don't do that. You always ask the PT or OT to come in, or you ask 2 or 3 people to help. Normally, we don't do that. Encourage the client to push, if possible, to assist with repositioning. Yes, always ask your clients to push. Means, Mrs. Smith, can you fold your legs while we would reposition you? On the count of 3, please push with your feet. It will help in the boost. I'm going to boost you up, so you need to push yourself up. She's going to do that, or he's going to do that. Now, transferring a client. Transfer is a method to move a client who can weight bear from one place to another. If your client is able to move from one side to another side, one place to another place, means it's a transfer. Lift, it's used for a client who cannot weight bear or must be manually lifted. If your client is not able to move, then you might need a lift, and lift can be manually or it can be weight bearing. Weight bearing means using a cane or this or a lift. Don't do that. Go into the use your weight box, please. Most often, a mechanical lift will be used to reduce the risk of serious back injury to support workers. Always, not most often, always we use mechanical lifts to support our backs. They will never ask you to lift someone. You always, what you do is use lifts. Do not lift them, no matter what it is. Nobody is gonna cover you. Transferring the client. If your client cannot help with the transfer, do not transfer without assistance. I'm telling you, and I will tell you over and over again. If your client cannot help you with the transfer, do not transfer without help. Always get help. Unless you don't have help, you don't have a lift, you don't have a partner who can assist you, Do not do that. Ensure the area is clear for a safe transfer. When you're moving the client from one place to another place, from one position to another position, make sure there's nothing, no tables around, there are no wires around, everything has been removed. It's clear. Otherwise, you or your client might get strangled in and might trip on. Always move the unaffected side first. Yes, you always ask them to move the unaffected side, because on that unaffected side, either arm or leg, they can weight bear. If you ask them first to do it on the affected side, just because they cannot weight bear, that's useless. He or she will trip on, not be able to support. Transfers from bed to chair or from wheelchair. Help the client out of the bed on their unaffected side. You always ask them on their unaffected side to get transferred. Means if they are right-sided weak, you will change the patient or move the patient from the left side of the bed, not from the right side of the bed. In transferring, the unaffected side moves first. Client should wear a non-skid footwear. Non-skid footwear means you first put a non-skid socks on it. You do not allow them to use their socks. You always give them the workplace socks, because those have that plastic rubber things which can hold on. If they are falling, they will not fall off, and they are meant to be of all sizes, from extra small to extra large. So check again on your client. Make sure when you put those socks on your client, it's not too tight, it's not stopping the circulation, or it's not causing edema. So please make sure the proper size, you are using the proper size of that non-skid socks, and then put on the shoes. But then you may use transfer boards. Yes, we often use them. Stand and pivot transfers are used. If stand and pivot transfers is, you ask them, can you stand straight, upright? Yes. Now hang on to the side rail and turn. Let's say I give you a walker. I would say, hey, Bima, just hold on to this. Okay, she's holding on straight. Now turn on your left side. While she's holding, she will turn on her left. This is called pivot. And you make her sit. This is pivot. When we do these things in lab, it will be more clear, but you still need to have a picture of it. So you do that pivot transfers. The client's legs are strong enough. When you are you're asking your client to stand or to pivot, make sure they are able to weight bear their strength, and they have the proper strength in their legs. If their legs are shaky, they're not doing well, you cannot. To bear all weight, yes, not some, really all. The client is cooperative and follows direction. Not all the time you only need cooperation, but you also need that they should be able to follow directions. If your client is cooperative but does not understand what you're saying, you cannot understand the language, you cannot speak the language, or they cannot speak the language, or understanding is broken between the two of you, you cannot transfer. The client can assist with the transfer. And when you need patients for sit and pivot transfer, you need to know that your client should be able to assist you. It cannot be you guys holding and helping. No, it is him or her. She's doing it. It's just that you're assisting. This is complete. This is moreover an assistance from your side, giving commands. This is not what we say you are going to do for them. Chair or wheelchair to bed transfers have the same rules. Again, when you're changing someone, you're putting them from bed to chair, or from chair to bed, or wheelchair to bed, or bed to wheelchair. It has to be same. Hold on the side of can you just hang on? Hold on to the side rails. Now up in the chair. From the chair, you will stand holding your chair on the side, and now you would turn around and sit up. So that's when you do this. You should always check the care plan to see what equipment and how many people are required for the transfer. again, when you're changing them, when you're transferring them, make sure you see what equipment. Are they using a cane? Are they using a two-wheel walker, four-wheel walker? How many people, one person assist, two-person assist, what it is, or a total care. So that's what you need to know. After transferring a client, report and record the following. Yes, it's very important. You let the nurse know, hey, your patient is now up in the bed. That's now her duty to check what needs to be done. But again, when you put him up in the chair, give a call bell, put the bed in the lowest position. When you say the client report and record, say your client is up in bed, the call bell is there, she's just lying in, let's say, semi-follows position. That's when you give a report. But she's not doing very well. She might need oxygen. Would you mind putting an oxygen for her? Period. Because you are not being delegated, you cannot do oxygen unless your policy says that your supervisor has given you authorization, or your nurse says how much to put on. I don't know. Your client is not able to breathe properly. Is he going to be on 1 liter, 2 liter, 5 liter, 6 liter nasal prongs, or is she using a face mask? You don't know. You can decide. It's in a care plan. She'll tell you, can you please put him on 2 liters? Then you put nasal prongs, you put the nasal prongs on. You don't decide what amount of oxygen they go. Okay? And if your client is on oxygen, and now somehow people who are on oxygen needs to go to the washroom, and they don't use bedside commode, they don't use urinals, they need to go to the washroom, they need assistance, and it's a wall one. You bring a portable cylinder, make sure there's enough. If it takes time, there's at least a liter, more than a liter in there. Bring it, you carry and you don't carry it on your back. It has wheel and it's like a strand. You put it in there, you just have to push it. You don't have to carry those cylinders on your back. Okay? Carrying cylinder means you put them in that stand and then, okay? The amount of help needed to transfer the client, how the client helped the transfer. And then you would also report, the client, he was able to move, she was able to transfer herself, she was able to use a walker, and I assisted. So it means they would say, yes, the client the client used, what is it called, washroom, care staff assisted, patient able to transfer back. That's what we do. Applying transfer belts, very important again. Transfer belts are used for transfer unsteady people who can transfer themselves, but they are unsteady. We put that belt, we hold, it has a, again, holding strand. You hold that strand and make sure it's just a finger or 2 fingers loose. More than that, it won't be. If it is more than a finger or 2 fingers loose, you might again have a patient who might fall over on you. Prevent falls and other injuries. Beware of the agency policies around using the transfer belts. When you're using, make sure you are already being given training how to use transfer belts. Unless you're not being given the training how to use a transfer belts, no need to do that. Because you will, again, if you do it, it is you. Why did you do without? Nobody will cover you.
Okay, ma'am. Is transfer belt same to like gate belt? Is it called as gate belt?
Yes. See, yes.
Yeah. Oh yeah, same.
It's same. Some are single stranded, some are thick. So we can see we have grooves, so we hold on to that. It's just that we don't do anything. They're able to walk off their own, but just to hold them, they might fall. We just keep for safety reason, we hold them here.
Mm.
Okay. Sometimes we don't use these large ones. we might use the small ones, which is this one.
Okay.
And again, they're color coded according to size. So please be mindful of the size, which one you're using. Do not use small one for a large person or vice versa. Other transfers is the basic transfer from bed to chair. I told you bed to chair and chair to bed. Commode chair. You would say, what a commode chair is like a chair which has an inbuilt commode. We use a non-usable, which is called a Vernacare product. We put a Vernacare product in, patient can or client can poop or pee, and we can again wipe it. The other commode thing, we can throw it. We normally degrade it in, it's called a Vernacare machine. You put that in a machine, it will break it down. Or wheelchair can be modified. So from bed, they can go to a chair. From bed, they can go to a commode. Or from bed, they can go to wheelchair. These are the three transfers they can do, or vice versa. Now, lifts are used to physically move clients from one place to another into either chairs, stretchers. You also need to, you might also need to transfer the client from your chair into the tub using a lift, which is called a sit to stand lift, or your client into the toilet seat. You will again use a Golgo or a sit to stand lift. Sometimes you might need a lift to put them in a what is it called, a car, a heavy dart, blue dart, if they're going for any appointments from the facility, because they don't get those things there. You are the ones who will accompany them. So you might have to use them in a way. That time we do use lifts based on what kind of lift the person is heavy, is 1 person, 2 person, that time. But a ceiling lift person cannot go there. Most agencies no longer allow staff manual, not no longer most agency, no agency, no workplace will tell you to lift manually. Never. Reason? It's not just because there are 2 reasons for it. One reason, they're social workers, they're support workers, they get broken down easily, they have backaches, they will call out sick, they will be short-staffed. Another, if you are hurt, it is the workplace who has to pay for it. So it will be an expense. One, you will not be able to show up at work. They're paying for you. Second, they will also be short-staffed. That's why they care about you. Not just being a human, but there are other human possibilities where they will never ever encourage you to lift them. It has been that when those agencies or facilities, they were telling, okay, you can lift him, but they ended up with short staff. They ended up paying more to the workers. They ended paying for their injuries, which was too much. It's better. No, no, no. And we don't care about the policy. We care about ourselves. That's why this is not accepted. Manual lifts, when working in home care setting, that's the client's home, you might be responsible for physical picking up of a client who cannot wait with. Do not. This should be done with the assistance. If you're trained, let the family member help you. Because you're doing a thing at home care. And home care, there will be, if this person is 1 person and normally does not do that kind of a transfer, suddenly ask for, do not do that. Either refuse it or ask the family member to help you. Okay? And ensure you know your agency policies regarding lifts, and make sure if they would say, hey, I'm so sorry, normally we don't, normally she doesn't move, and I'm not pretty sure how she can do it. Is she able to manage it? Can you please help me with this lifting? Ask very politely, to the family member. We don't say, no, I won't do it. There's a way to say, I can do it. Would you mind helping me? I'm not pretty sure how she might do well with this transfer.
Ma'am,
Yes, ma'am.
what would we do if there's no family members
If,
that time?
yes. If there's no family member, simply let your client know. I'm so sorry, whatever the name is. Unfortunately, I won't be able to do such a transfer because I am alone and I don't know how you would be able to manage it. We might delay this for today. Let's do it tomorrow. I will ask someone for help. You really ask politely, but you don't do it. Once in a while, if it's a dire emergency, things might not go well. That time you might do, but don't do it. Don't make it a routine. Now, let's say something happened, no family member, and it's not just that it would be a safety concern for your client. That time you might do it one time. If it's not a safety concern, ask politely and say, I'm so sorry, Mrs. Smith. Why don't we do one thing? I will get some help tomorrow and we'll do it. For now, I am unsure about how you will do with this transfer. Beautiful. It's a refuse, but in a nice way. Right? There are many different kinds of mechanical or electric lifts. I told you. Knowing one type of lift does not mean that you know all. No. They all work differently. You need to know how to operate them all differently. Even the beds that you use have a weight. Your nurse might ask you, can you please weigh the client? And she's always in the bed. She's total care. What do you do? How do I do it? I don't know. What is she asking me? Simple as that. Okay, no worries. Based on what the client is he, study please, is he a total care? Get your co-worker, put the patient up in the ceiling lift, let your other co-worker hold the ceiling lift, put the bed on 0, making sure no pillow, nothing on the bed, just the bedding only. Then put the client on the bed. The bed will, and you will see a number on the bed. If ever not that, get your client, get the lift. That's why I said every machine that you use, they operate differently. So if you have used one, does not mean you know all of them. If ever you come across these, try to always operate them first before you put your client on, so that at least if things go wrong, nothing is gonna fall off, nobody will get injured. Am I clear? It is your responsibility to ask your supervisor how to use the lift if you are unsure. So making sure in your time out, you go there and see, oh, let me see how this works. Okay. Mechanical lifts are used to transfer clients who cannot help themselves. If they are heavy, too heavy, ask, even if you are using a lift, ask staff member, another support worker, another HCA, or your nurse, LPN or RN to help you. Employers usually provide special training for the use of it, not usually. Before you start your work, before you go on to your first day of work, they give you orientation. During your orientation, they give you training on how to use these machines. If ever they fail to let you know how to use these machines during your orientation, it is your job, it's your moral duty to ask, hey, can I just quickly get a rundown on these machines, how these lifts work? I'm unsure. You don't say, I don't know it. I'm unsure of how these work. Can I quickly get a rundown? They will show you. Before using a mechanical lift, you must be trained to use it. Make sure it properly works. It's not broken. Yes. Before you put your client on, try to turn it on, try to turn it off. Stop. The client's weight must not exceed the lift. And there is one thing, if your client is very, very heavy, there is a specific weight for each machine that it can lift. Do not use that machine then. Based on the client's weight, the machine needs to be operated as well. At least 2 staff members are needed. Yes, always follow the manufacturer's instructions. Sit to stand mechanical lift allow the client's transfer from one seated position to another. That's from bed to chair or vice versa. Sit to stand lift is used for toileting, for giving pericare or changing incontinent briefs. If your patient is or your client needs to be toileted, has had a BM, needs to be changed, brief change, we always use sit to stand. They hold on it and then there's a flap, you put that on, they get safe and they can, you can change them. This type of lift is good. This is very common and very easy to be used and very safe. This can be used anytime and it's so friendly, easy friendly using machine. Everybody, no matter whoever works in the healthcare, loves using this. Clients who are cognitively aware enough to cooperate with instructions. The only thing that you need for this sit to stand lift is your client should be able to follow commands. When you tell them, hang on to them, they should be able to hang on. That's when your client is oriented ×3. Client should have good muscle tone in at least one leg or upper arms. So yes, if your client is able to hang on, that's why I said if they're able to hang on, if they're able to hold on this is the best one to use. Are we end of it? Yes. How was this? Was it okay? Any questions up till this point? And when you are transferring, again, make sure privacy. All the time, privacy, please. When you need to put your client up in any of these things and you're using this, if the family is on the side, ask them, would you mind just stepping out for a while and then you can come back in, will help the patient, will help the client. Because things might not work the way you want to. It might not look beautiful. Families get upset.
How about if the family they don't want to leave and they say, "Oh, it's okay, I'm gonna stay."
It's okay. No, we did our part. We did say to them, if ever things go wrong, if they report, you can always tell your supervisor. They will not at least penalize you. They would not say you did something wrong. They understand it was not your fault. It is the family's fault. If let me give you an example. There are families who are always looking for trouble because they want healthcare to pay for them. You ask a family member, can you please step out for a while? We'll just change the Mrs. Smith, or we'd like to change your loved one. And can you? And she said, no, it's okay. I'm here. No problems. Okay, you changed. They went to the supervisor. Oh, you know what? This support worker was so rough. I was there. I was watching. You go and ask. Tell your supervisor when they ask you, oh, you have been robbed, there's a complaint. Yes, I asked the client's family to step out, but they didn't. They were very nosy. We haven't been robbed. She will understand. Yes. So some families, they are only doing this for the purpose of looking for trouble, and some they're very, very nice. They're so helping. They will not even they'll tell you, it's okay, I'm here, I'll take care of my mom. I'll take care of my dad. We always have good people and bad people around. Okay? Now, let's go back on this point. It's time for you guys to reply. Each one of you will be answering questions. I will not pick and choose. I will give you guys an opportunity to be adults, but not all the time one person will answer. Everyone will answer. Everyone. This is not an exam. Again, we are not examining anybody. We are just sharing our thoughts on what we have prepared and we have done. I will ask, so that the purpose for me to ask you guys this is just to know if I need to go over with things that are been covered. Okay, let me look at it. Just give me one moment. Where is my evolve? Here. The first thing that we would be, yes, my dear. Let me share this one here. Is your role as a support worker. So tell me, what do you think your role as a support worker is? Any facility, any residential home, any care home, or any hospital. Again, I would repeat one more time. It can be any setting place. How would you think is your role as a support worker? What are you meant to be there?
Just follow the five that principles of it,
Okay.
like take care of the patient, do all the stuff which you taught. With regard to your personal safety, and if the client refuses for treatment, then you don't have to do anything.
Yes. Okay. Anything?
I have a question.
Yes, my dear.
So basically, these are the questions that you're gonna ask us tomorrow that we need to work in.
Sorry?
These are the questions that you're gonna ask us tomorrow. That we need
No,
to work
now we are answering them now.
Oh,
Yes, as Amrit said that we said, how do we play a role? He said we would be following dips, be providing care, helping. So, is there any other thing that you think that how you will support, or what's your role of being a support worker? How do you do? What do you
And
that
another thing is, we need to be responsible.
you
can you go?
Okay.
Yeah, thank you.
yes.
Yeah. So another point is, we should be responsible, and before doing anything, we should inform the client that we are doing this and that, so that
Yes.
they will be prepared and
Yes.
it will be safe for both the client and us. Yeah.
Yes. But see, when we talk about your role as a support worker, you also have to make sure it's not only between you. I would repeat myself, not only between you and your client, also between your client's family,
Oh.
your other co-workers. It's
Mhm.
not your client, but she needs help, right? So your role as a support worker is to be a team player. The best answer is to be a team player, working with each other, right? Helping your client, as he said, keeping in view the dips, dignity, in promoting independence, promoting confidentiality.
Privacy and safety.
Yes, all those things, making sure you're helping your client, helping them with their activities of daily living, or also being an instrumental care, giving at various different levels, giving medications, because normally you don't give, but when you are working with home care, there you might give. So all that is, and other than that, you also play a role between the team members, communicating about your client, informing your client's family, assisting your client's family. That's you not only help them bathing, gowning, eating, feeding. Sometimes they need support. Oh, I'm so low today. I'm not feeling good. I'm just missing my family. Oh, it's okay. You sit there, talk to them, provide them sympathy, right? So that's your role, how you work within a facility, within a workplace. Within a workplace, you do not play only a role at one level, but you play at different levels. Sometimes,
I think you need a hell lot of patience to do this job.
yes,
I
that
should start. I should prefer a morgue or a mortuary.
yes, my dear. And sometimes you might have to answer one simple thing, one simple question
Yeah, 100 of times. Yeah,
over and over again.
yeah, we
That's why,
do the same thing over here.
yes. Uh, could be I might be repeating one thing over and over again because you have to build in your self this skill of repeating, being patient, and listening about their things. It's sometimes so bogus and so boring, but you have to, oh yeah, no worries, no worries, just because you have to transfer her, just because you have to change her, you don't even know what they're talking about, right? So you have to have those listening skills. You have to be a listener. Your role is to be a listener. Your role is to redirect. Oh no, you need to go back to the bed. No, 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 no. And if he's confused, you might in 1 hour, you might repeat it more than 10,000 times. That's the beauty of being in healthcare. It's not only about your job, it's the beauty about being in healthcare at different
No,
levels.
it's about all the jobs in Canada. You don't
Yes,
have that liberty of back home, like giving an OTS.
yes. So that's what. And when we say settings for support work, also please make sure you know what and which area you're working in. Some areas that you work in, let's say it's psych area. Psych means people with mental issues. It is more demanding. You might have to kind of have more patience. It will be, you also have to be very careful. There, your clients will be more aggressive, they have mental issues, and things can also go unexpected. So working in a psych unit would be like, okay, I might think. Honestly, if you're not prepared how to work with mental challenges, if you're not kind of prepared working with anger issues, you might not be the one who will work around that area. Your clients, your residents, or your patients, based on the facility, based on whatever setting you're working in, you might see once in a while anger issues, but not every time. I mentioned it last time in one of the sessions. We don't abuse and we don't get abuse. Abuse is not accepted. So if your client is verbally abusive or physically abusive, we gave meds, we restrain, but she's still yelling, close the door, and you leave. Once she settles, then you go and provide care. Otherwise, you don't provide care. No matter what it is, you're there. She's only one person suffering. But if you get hurt, if you get in trouble because of you, your clients, your own self, your family, and your employer all will suffer. So be, please be very mindful of how you need to behave, how you need to act. Pay, put your emotions in your pocket. Work with your brain. This healthcare is where you need to use your brain more than anything else. You think your client is she's talking which is unacceptable. Oh, the support worker, the care aide who helped me earlier, she stole my money. She might not be aware of the statement that this client now is saying. It can go against you. So please go and report it to your nurse. Say, hey, she's just talking, I don't know what she's what she's saying. She's confused. She said the earlier support worker or the earlier care aide stole her money. They report it. They write it in written reports. If ever things go wrong, nobody is accused of stealing. So again, whatever you see, whatever you hear, and whatever you listen from your client is very important. Your client might say, oh, I don't need this thing forever now. And she's giving away stuff. No, 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 you might need it tomorrow. Oh, I don't need it now. I know it. Your response should be, Mrs. Smith, may I know why you don't need it? What makes you say you don't need it? She might have a plan to go for a suicide. At least when you ask the question, you get onto the fact. This is yours, Mrs. Smith. Why won't you like to use it? You don't like it? Give options. Try. Remember what I told you? You need to start with open-ended questions, yes or no, and then close. That means you will keep on digging. But digging in the way where it doesn't harm you or your patients or make the situation worse. And you do not breach policy of confidentiality. So you might ask, why don't you need it? You don't like it? Do you want me to put it away for you? You might use it next time. Oh, I am not using it. Why? You see, she's aggressive. She has episodes of all these things going on. She has a history of suicide or mental issues. It might be she's planning for suicide. 100 times these things happen. So you are the eyes. You need to be very vigilant of what you hear, what you say, and do not add your words into it, only paraphrase. Client said, I don't need it. I am done with it. You don't say, she told me she doesn't want to use it. No, we don't use past and present sentences. We only paraphrase it. Use the same words, put them in double commas, inverted commas. Am I clear?
Yes.
Facilities or settings. I told you hospital, the other name for hospital is acute care. If it is within the hospital and it's not a study, please do not irritate Shaha. If it's a medical ward, if it's an emergency, it's called acute care. If it's the part of hospital which is a palliative care, and we call it subacute. A long-term side of a hospital is called subacute area. You might be in an acute care, you might be in residential care, you might be working in long-term care facilities, you might be working in community homes or clients, home care, private or government. So please be mindful of what you are. Again, if you are going to client's home, abide by the policies of your workplace. No pet policy. Make sure you do set your rules for that. Don't touch the pet that day, next day, report it. Some of your client, I have given you an example before. Some other clients, they have hidden cameras, not for you, but for their own safety. And then you report to us, the dog was out, he was trying to lick. When we go and talk to them, when we report it to their case managers, they tell us, you were the ones who were touching the dogs, who were playing with it. Was it in your policy? No. You would be as do not acknowledge. Do not acknowledge means you will not be sent to that client anymore. That means you might get less hours of work. When you work, think how it will affect you and your client. Each activity that you perform is going to affect you, your work area, and your client. If you think your client needs to take some time, takes time in peeing, you do not stay there. Give a urinal, help him and say, hey, I would step outside. I'm just here. Press the call bell when you are done. In those 5 or 10 minutes, giving them privacy, giving them time, putting the curtain back, it will help the client, one, to pee, and second, for you to do something else at the same time. You don't stay there forever and ever so that you are left with a lot of things. If you are working, think of if you are wearing jewelries, if you have long nails. I have seen all the workers, no matter from any level to up level, they get their nails painted, long nails. Would you be able to clean up your nails every 5 minutes while you're working? Trust me, they get so dirty, you might get infections. If you are coming out of the client's room or inside the client's room, please, 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 again, I'm saying, no matter we are in a COVID zone or we are not, use hand sanitizers. After every 3 use of hand sanitizers, wash your hand. Use proper cream, hand cream for your skin. If your skin is broken down, you will be at a risk for different infections. You don't want to look ugly. You don't want to get into trouble for your family. You want things to be nice. So making sure you're not wearing so much expensive jewelry. Sometimes you might bend, your patient is confused. She might pull your chain. Workplace, that's why when you're working, you might see some people, they come up, they dress up in a different way. Use your brain box how I need to be in this workplace. Even if I have a policy of wearing shorts up till the knees, we do have policy when it's hot weather, you can wear shorts up till the knees. Use your brain. If I'm working in an area which is more of I have spills and all, should I be using it? It's your decision. It's your discretion. What if you have a badge on? Should I put it so much long, or should I just get that badge stick? If I have that long chain one, my client might pull me. I might get hurt. You always have to think of going inside your client or outside your client room. I told you, when you're going into your client's room, make sure your door is at the back of you for your exit. When you get inside, do not step right away. Knock the door. Hello, Mrs. Smith. Good morning. It's me, Amber here. Introduce yourself. I would be giving morning care for you. Let's start. This is promote independence. Give a wipe. This is a warm wipe. Would you mind washing your face, wiping your face? As well, I will clean up you. I'll give you a sponge bath. So for that, I will try to open up your gown. She is aware and she knows you're gonna open her gown. Somebody, if you think about this, if you're getting changed and you're not being told that someone will take your clothes off, how will you react? Would you not move your arm or leg? Yes. Is it safety? Is it privacy? Yes. And at the same time, you might get hurt, punched. If you are providing care, you are giving. Huh? And let's say, I would say, if you're giving care, give them a brush. So tell them if they can hold the brush, if they can gargle, give them a basin, they will hold the basin. Right? If there is a what happened is, if your clients are, let's see like this a picture. You're gonna give, you set your client up with food she can eat of her own, but it's your activity of daily living. You forgot, or you did not check your client, you didn't get time. These things happen. So she needs to get, she uses dentures. Today you didn't get time yet to get into her room. You wanted to first serve her breakfast. You sit her up, everything done. In a hurry, you did not put dentures. Would she be able to eat? No. At least while you are going, you need to give all the time making sure call back. If that denture last night that co-worker who worked did not put it in water, would you be able to use it in a hurry? Make sure you think about it. What if this happens? What if it's the next time is not me? Nighttime, you took the dentures out. Just take them, put them under the water. You have a glove on, run down, put the tap on, just quickly water, get the brush, and if there is any debris, put it in that denture cup, put the water in it, and close the denture cup. Get, every patient has their own label. Make sure if the box is not labeled, you put a label on it. If ever they get transferred, if ever things get moved, at least there is a label saying whose denture it is. Make life easy for you, for your client, and for your co-workers. They will help you. If you work diligently, your co-workers will also help you when it comes to you. If you leave a lot of work for them, they might not report because we don't go, we are adults. We don't go every time going for like a newspaper every day to your supervisor saying this person left like this crying. No, we do the same thing for them. That's when they don't do things for you. They don't provide. They don't. I'll put it, leave it. So they don't do it for you. That is the reason I'm telling you, make sure you make things easy for them. They will do, they will make it easy for you. If you are a nice support worker in your facility, if you help your nurses very well, your reporting is very good, you do not report wrong, there is a chance that your facility will take you over for other courses. They think, oh yeah, she's always reporting the right things. You know what? We would like you to be used in trauma. So you'll not be doing personal care. You will do the vitals for all the people who would get in. You change your life yourself. It's up to you. You're so good at it, you might be only doing stacking. You don't misuse things, will use you for uh, how much and what we need. So this is all the time we need to help each other. We have to be careful with our things. We don't have to do sometimes it's like the families, they know who they want care from. When you're working with home support, most of the times the family will call us, hey, is this a supervisor? Yes. We don't want let's say ABC to be there, can you please send the other person? And we have a right to ask. We always ask them why. Oh, my mom, she loves her, she really like, and she takes very good care of my mom, so we want her to be there. That means your hours of work are increased. Your employer might be able to pay you more just because he or she The employer wants you to go to the client's house. You know what? Just a simple thing, the way you worked would help you get more and more. Yeah. But again, please make sure safety, confidentiality. If it's your family, Shah, come here. If it's your client, you do not give. Just one moment, please. Okay. Gugu, gugu, mugu, jugu. Kale jugu kodde. Kale jugu kodde. Jugular, jugular. Say jugar cham. Say jugar cham. Ah. Bagal, bagal. Bugle gum? I'll give you bugle gum. Tell it to brush. I'll give bugle gum. So you have to make sure bugle gum. Brush your teeth. I'll give you bugle gum. Yes. I'll give you bugle gum. So what we do is, if you are a diligent person, you will get more care. You will get love from your employers. Sometimes you need a day off, you're going for a vacation, you're not due for your vacation. Trust me, your employer would try to manage to help you and get your vacation due. I've seen things happening against the things also, just because they value that person more than anything. So making sure you're doing right, you're helping your nurses, your nurse knows she's always there, helping. Social support, and you were not there on the day we discussed confidentiality. If clients' families ask questions, not everybody needs to know each and everything. You always say, yeah, you know what? Let me do one thing. I'll just get to know about the client's information and I will get back to you. And saying get back to you does not mean you will not show up. You need to go back. If you told them, I will be back in 5 minutes, at least you should be the one getting back after 7 minutes. If you told them, I'll be back in 5 minutes, and after 1 hour you will come up, your client knows she's lying to me. They don't trust you. The thing is, you lose trust. Your client loses trust on you. But if you tell them, you know what, I'll be there, they sometimes test you, or and you go back, they understand, oh, she doesn't lie, she really comes back. So she'll be here. I don't need to get out of my bed. I will wait till she comes. But because you work in the facility and your client is the same, you told them, I will be back, but you never ever show up. She knows, oh, she told me she'll be here. She never comes, but she never comes. She will step out of the bed on her own. And this is a dumb and fall. She might fall. She might hurt her head. She might hurt her head. The time is, there's a big loss. Even some patients might die. Who created it? It's us. Why? Because we told them we'll be there in 5 minutes, but we never, our 5 minutes were never 5 minutes. So please do not say, I will be back in 5 minutes. Say, I will be back. I'm not sure when, but I would come and see you. Am I clear? Please do not lie. Just simply say, I will be back. I'm not pretty sure when, but I will come and help you with this one for now. That is when your trust is there. You assure and reassure your patients.
How about when you say, oh, I'm gonna come back whenever I can, and they say, oh, they're like, they feel some type of way. What are you gonna do?
No. They know. If it's she wants to pee, you would say, I will be back. I'll just come back and help you. You will come back in 5-10 minutes because you know the person cannot hold. But if it's just, I need you to help me with my books, when they know you come back, they do also. Mostly when you work with them and you come and assure them and you fulfill your promise, they know what is going on. They will wait for you. They take your word as a word. Trust me, I have been in this, not only here, but I have worked with all levels of people. It is that they gain your trust, they love you. Whatever you say, that becomes the word of God for them. I'll be back. Oh, somebody will tell them, let's go to play bingo. Oh no, I will. You can go. My what they remember your names. She will say, or he will say, she told me I'll be here, and they will wait on that side for your bingo. That's why each and every word coming from your mouth does make a big difference in everybody's life. So don't say 5 minutes when you come in an hour. Simply say, I'll be right back. I might take some time though, but I'm not pretty sure how much. I will come and see you. Which is the best way to not lie. And also not keep them waiting in, it could be 5 minutes. They know she'll be here at some point. They don't stay waiting for 5 minutes, 10 minutes, 2 minutes, because they will keep on looking at their watch like this. Otherwise, when they know it will be any point, they know, oh, it's okay. We can keep on, we can carry on, and then things will be like that. Okay?
Okay.
Making sure when you are feeding, do not feed until you have checked what the patient's diet is. If you haven't seen, if you don't get a chance to check the patient's diet, ask and confirm with your nurse. Is your patient or is your client able to? Yes. If your client or your patient is she's ready to eat, she can eat. Sometimes she might have to go for a test. I saw a sign there. Is she okay to eat? She might went for a test. After that test, you cannot really go and get started with the food. You only start with ice chips, then you start with clear fluids. Then when you tolerate clear fluids, you go slow and steady. So that's when you ask, I don't know this patient. If you don't know this, participate. See, you fell down. I told you, you will fall. Don't go. If you don't know your patient, please and please ask your nurse, can you please tell me how this patient mobilizes? They will tell you, he's 1% assist, he's 2% assist. Can you tell me his or her diet? He will tell you what the diet is. Because if you don't know, is he able to move? And just because the patient is confused or your client is confused, told you, I can get out of the bed, he falls. You can trust on your client. Sometimes yes, sometimes not. Because he's new to you, you don't know him. You don't know her. So that time, do not trust. Always the first instance is when you tell them, okay, hold on, my dear, I'll be back. Go and ask your nurse, can you please tell me the mobility of this patient? Can you just tell me the diet of the patient? This is very, very important to know. Whether he is on a puree diet, I need some water. And you never have had this client before. For heaven's sake, not in a good way, go and give him. No. Okay, I'll bring you some water. Meantime, I will check with your nurse. You go and ask, is he able to take water? He might have dysphagia. He might not be able to drink water. He might get thickened water. You gave him water, simple water, he choked on it. Your each and action, every action you do can have good and bad effects. So If you don't know this person randomly asks you for water, you say, okay, my dear, I would, but I would just double check with your nurse. Go and ask, is he on any restrictions? She will tell you, no, he's not on any restrictions, he can take water. Okay, boom, you go get water for the client. Things need to be done in a proper way. If we do not play a diligent role, we might put ourselves into trouble. We might put our clients and our clients' families into danger. We always have to make sure we follow each and every time the rules and regulations. That's your time when you have to, you do not have to do things that you can do. You don't have a scope, but you have a scope. The way I say you don't have a scope is you don't follow any nursing body, but your rules are set up by the employer. Your rules are set up by the setting you work in. Making sure if you are helping your client's family, do not discuss anything. Do not talk about your personal issues. If they give you something, do not accept. We don't accept gifts. And it's okay. Thank you very much. When they see you have been very helpful, then they might get coffee, they might get Timbits, they might get chocolates for everyone to share with. Personally, we cannot accept a gift from family. If ever they want to, they go to the supervisor, they give it to the supervisor. The supervisor will give it, then it's the supervisor. In home care, things are different. In other settings, it's different. But on your personal level, do not accept. Am I clear? You have to make.
Sorry, how about if you say no, I don't want it, like I'm good, like and then they keep like forcing it. They keep saying, no, please take it. It's a gift from us. They please take it, take it.
That's what I'm saying. When they tell you, you will have to tell them, oh, you know what? We are not supposed to. If ever this says, you can just give it to the supervisor. I can't accept. So they know the way. You can give it to the supervisor if she allows it. Then yes. Trust me, when I started up working as an LPN in ER, that time they had gifts. When I did not accept, oh, I'm so sorry, we can't accept gifts. When I used to come after days and days of work back, they would say, the supervisor will call, hey, you know what? Last week you helped someone, and the family of this member, they just left this note for you, and there's a gift. They know. This becomes a policy. That's why I said your work, whether doing nice job, being appreciated every time, will change your employer's policy towards you. If you have reports, she doesn't know how to work, she doesn't know how to do things, things will be very difficult for you to work. As a care staff, initially it is very, very overwhelming if you don't know how to. You don't know, you're not used to working, and you don't know how to deal with people, you don't know how to deal with your own emotions, you get burnt out, you don't use your resources right away. If you are burnt out, you don't go and check on the policy, how many hours I'm supposed to work. Do I want to work part-time, full-time, or casual hours? I'm not able to decide. All these things will affect your life. If you can decide things for you, it will come and bite you. That's why it's very important for you to know what I should and how I should plan my journey. Yes, things might not be the same as you planned. It can change and it varies because unexpected things happen, but at least you have a backup of, I will work casual. If I'm burned out, it was a very heavy day for me, I can take a rest tomorrow. So who initially told me, to go for a 5-day work. I will take a full time. When I don't know how the workplace is, why don't I take mini steps? When your employer hires you, oh yes, I think for now I would go casual hours and then I would take up a line. You have to think critically of how we are doing things. We don't want to be liars. We need to think what is good for me, my client, and for my employer. How I will be liked by everybody. How it will not affect my life. You work with your other group of doctors. I told you, you'll work with the physiotherapist, you'll work with an occupational therapist, you'll have pharmacy covering with you, you will have doctors, LPNs, RNs. Another thing, you also work with porters. Sometimes you transport patients from, okay, it's your brush, thank you. You transport, normally it is a porter who will take patients from one area to another area. But at the same time, if you are short of porters and it's a facility that you work in, you might work even as a porter. Your job is to transfer patients not from bed to chair, from one department to another department. Otherwise, if it's a patient who's always in the bed, who will take them? It's a porter, because you're caring for 5 of the patients, you're caring for 10 patients. If you're gone for half an hour, what will happen to other patients if they need help? So you have your own assignment to work on. But sometimes when you are working, you might be asked, would you mind doing a transfer for me? And then in that period of time, when you transfer one client, one patient, one resident from one floor to another floor, from one place to another place, not from chair to table or bed to chair or bed to wheelchair. No, from one specific area to another specific area, you will be covered by another care person, worker. That time you work as you are a porter. Otherwise, normally porters are different set of people who transfer people. Assentees are those who take people from one facility to another facility, one workplace setting to another workplace setting. So we work with a diversity of people, group of people we work with. Am I clear? Okay, let's see. Where is this gone? Oh, shoot. It's okay. I'll just put it back. STR. No. Okay. So it says here, it says, you've done these stupid links. No. We can go over these links next time. I don't like links, following links. We have already covered all these.
What?
Yes.
Me.
We done with these links, my goodness sake. Stop it, please. Okay, here. Describe healthcare business, describe the goals and approaches that you're doing. Describe the purpose and function, employer policies, we discussed it. And discuss the importance of maintaining client, family, and confidentiality. Again, at this point, I would say, why you need to, when we say confidentiality, why we need all that thing? Why we can't tell our families, our clients' families, everyone, what is going on with the patient? Why do you think we need to hold on to some things? We did go through this, right? Nima, can you tell me why we don't have to, why we don't need to give everybody each and every information?
Because sometimes it's not good for others to hear about that client. You should always keep it to yourself.
Mm-hmm.
And that client, whatever happens stays in that room basically, and it's not good to air their business out.
Yes, and another thing, what about the family, within the family? Are we supposed to give each and every piece of information within the family?
Oh, you always
No.
to ask our supervisor or to ask them for more information. We can't give them if they keep asking us, we're gonna say, oh, they're doing they're doing fine. That's all I know right now. I can't tell you more than that.
Yes, so what you do is you will always tell them, you know what, at this point they're doing well, but I would like you to go over with the nurse and she will let you know about this client. So the nurse will see on the on the file who the next of kin or the SDM is. So you're not the one who would report.
Mhm.
Just say, hey, yeah, I know he or she is doing fine for now. And if you need more information, I would like either if they want you to know, I would come check on it and I will let you know, or you would simply direct them. Would you mind checking it with the nurse, in charge nurse?
Is it like we also don't tell them just because they might have some kind of vested interests
Yes.
or something, because we are not sure what they're going to do with that kind of
We don't
information?
know what they are going to do. We don't know
Yeah.
how the procedure went, what the diagnosis. Sometimes, honestly, you know the diagnosis. Oh, my
Oh, yeah, but we are not sure like to tell the family. Like they
yes,
might be waiting for their will to open up a will or something like
yes,
that.
that's what I'm saying. They might need this piece of information to open up a will, to do things wrong. So we give this piece of information. This is gonna come against us. You simply say, hey, you know what? I'm unsure about how things happen. I'm not updated. Let me get you an updated picture. Or if you don't mind, would you mind talking to the nurse in charge? So the nurse who's taking care of it would say, if the nurse feels like this is not the person I should talk to, she will redirect him to the supervisor. So the supervisor say, hey, you're not the one who's on the file. I'm so sorry. Or simply, if he keeps on asking and asking and there's something wrong, simply say, you know what? Unfortunately, we will not be able to give you this much of information as you're not the person who is the person to be notified on file. Can you please check on with, let's say it's Amrit. Can you please check on with Amrit, who's here on the file, and he will give you the updates. So it is between Amrit and Amrit's family, Amrit's sister, Amrit's brother. He will tell them what to do, what piece of information they need to know. We simply sometimes do not become liar. We say, may I know your name, please? Yes, my name is Ambreen. Oh, Ambreen, unfortunately, you're not the person who needs to be notified on the file. It's Mr. Amrit. Can you go and check, please, with Mr. Amrit? He will give you an update. I already have updated him yesterday or just uh, today. Simple as that. Okay, if they are not troublemakers, they will say, okay, if they need trouble, oh no, I don't, I'm so sorry. At this point, I can't help you. You can talk to the supervisor. Simple as that. Short and precise. But we don't want to get, you want to open up things, go and do it at your home. Not at my shoulders. I don't want to be a piece of person who is responsible for all these things. And then it says the role and responsibilities within health, labor law and union. I have already told you, union is there. They cover your back. If there's a shift bid by 2 people, you got it, but your seniority is more than the other person, you might grieve it. You will get, still you didn't work for the shift, you would get paid for the shift. Or if you are the one uh, who bid the shift, got there, but something happened, they will send you to another place. You will call the union. You know what? I was supposed to work 8 hours, but they send me off 4 hours early. There's nobody, they got there, but I just got back in 4 hours. The union will make sure that the employer pays. Something you couldn't come on time, things don't work well, your employer is bossing you around, he's trying to sabotage you, asks you to work which is not in your the time you sign the contract, it was not on the contract, you can always approach your union. So that's what we are talking about right now. And we say delegated tasks again. You as a support worker, K-RAID or CHW, these are the three names in different settings you work. Can be called as a K-RAID, you can be called as a community health worker, you are also called as a support worker. So depending on this, you are a non-regulatory body, means you don't have any specific body who runs and sets goal for you. You are a non-delegate, you have non-delegated tasks. At a point, you work and get regulated and delegated, but normally you cannot delegate someone or you cannot get delegated. When it is you work in home support, your powers may change that time. Even though you're a support worker, a CHW, community health worker, you will give medications. In normal settings, you never give medication. But then that time, you work under a nursing supervisor. The nursing supervisor would simply give you your uh, power to do. So what they do is she will train you under her name tag, and you do provide care. It is your mistake if you do a mistake, you and your nursing supervisor both are responsible. It's not only supervisor, even Fraser Health that time is, it comes under Fraser Health. Coastal Health has their own, but I've not worked with Vancouver Coastal Health, so I don't really know how it works for them. I only know about Fraser Health. So it's Fraser Health, they know we have sent those CHWs. They are not, they don't know about medicines, but they still give it. They give you training if ever something goes down wrong. The delegation of tasks that you are being given, it's called DOT. It has been taken away from you. We do again. That doesn't mean you're laid off. You will be fired. No, either they ask you why you did it. First time you did it, please do not repeat this mistake. They will retrain you, and then you do a demonstration. You go and work under somebody for a while. After that, you're set to go and work independently. So that's how we work. We always shadow. Initially, you shadow people, and then after shadowing, when you know how this person works, this is how I'm going to work. They shadowed me for the whole facility. They shadowed me for the whole home care support thing. That's how we work. Things go wrong, we are given chances. If you haven't done something, this is first time you're doing, you can always ask, hey, I'm not pretty sure how to do this, or I have done this a very long time before, would you mind giving me a quick demo of it? Do not hesitate. Make things simple and easy for you so that life will go easy. Is that okay? Because we work with variety of people, we work with lots and lots of people. If you are hurt, you come back from work and you cannot right away start working. You are always coming back. You will be called as gradual return. Gradual return is you get 4 hours. In 4 hours, you will get you will stand on the floor for 1 hour. Rest would be the break. Then the next gradual return will be 6 hours, 4 hours work, 1 hour, 2 hours break. So gradually they put you back on the floor. This is the case when you are injured. But if you're not injured, you make mistakes. Again, there would be a kind of gradual return for you. That is when they ask you, why did this happen? How we can prevent this to happen again? This is the plan. This is, we will go over with it on a learning hub. Go on this and do your online certification. Once you come back from the online, we'll give you a class demo. You get a class demo. Whatever your nursing supervisor will show you how to do it. You will demonstrate same thing back to him. Then you shadow someone. After shadowing, you start independent. This is how the plan of action works. Is that okay? Every fall that happens is not because of us, but if falls occur all the time, the facility becomes a red alert for the Fraser Health. That's when the facility does is, who is the nurse, who is the support worker, or who always works with these patients? What is wrong with this patient? Why these people on the time when this support worker or when this nurse works fall? At a point, it's true, we're not responsible, they're dementiated, but also we have to think, did we use our correct judgment? If we know they climb out of the bed, did we notify the supervisor? You don't go directly to your supervisor, but did I notify my nurse? Yes or no? Has a nurse already reported? Sometimes if they tend to fall several times, you say, hey, Maria, you work these shifts. Have you talked to the supervisor what we can do for the client not to fall? This is how you ask. Oh, maybe we, you know what, we will move this patient towards this nursing area. During the day, we'll not keep this patient in his room or in the dining room. We'll move her on the wheelchair or on this recliner all the time near the nursing station so that we have an eye. So you plan your journey. Only people with quick brain, who want to use their neurons will be able to work. It's not difficult. It's so easy. It's only a matter of organizing. If you're a good organizer, you know how to organize things at your home, you will plan it safe and steady. But if you are a person who touches one thing in your home and 10 things fall over you, think about the workplace, right? I hope the session was a bit better session than yesterday. Yesterday I'm so sorry, I worked 48 hours in a row. I was so bloody sleepy. I did not know how I was teaching. Trust me. Okay, so I think for today we are good. If there are any questions, I'm here to answer. Otherwise, we'll take the day off. How is it? Any questions? Nobody has questions?
No.
Okay. I think Amit will come back and we'll see if he has any. Amrit, if he has any questions. If not, then we'll call the day off for today. Okay. We'll be back tomorrow, 8:30 again. Same place, same time. you, my dear. Have a wonderful day ahead for everyone. And let Amrit come and we'll call the day off. Amrit, any questions at this point?
No, ma'am.
No? Okay, then we are done for today.
Which is which is the highest paying area in the healthcare area? Like,
Yes.
or like job, which is the highest area?
The highest would be first, it is a specialist,
Okay.
then a GP, then RN, then LPN, and then support workers, then is housekeeping and others. You get paid, I think in this, you get paid around $26 an hour, between $23 to $26 an hour minimum.
So it's same in the resident area
Yes,
or the
yes.
hospital. Okay.
But only home support you get paid more. Home support you get paid around $30 an hour. Otherwise, residential care, hospital, no matter where you work, you get paid around 21, 25, 26.
Wait, so home cares do get paid $30 an hour?
Yes, home care you get, I think, $2, $2 to $3 more, because that's as I mentioned, it's it's a delegated task. It's a nursing job where you give medications. That's why you get $2 extra.
Okay.
And plus the mileage is different in home care. If you in home care you go in a different clients' homes, from each home to each home, whatever mileage you use, every month or every week, it's up to you, or every day you wanna you would submit reports, you get paid. Otherwise, all the settings are same. Between the minimum, before it was 21, then it changed to 23, but I think it's 23 to 26 now.
Ma'am, which area is like the toughest one to work?
Toughest one is psych.
Oh.
Psych is very, you don't have to do, you know what, you don't have to change the patients, but at the same time, you don't know how the patients react. All the time you have to run, get those panels, get the patient in restraints. It's very difficult. The best is either you work home support, or if it's the nearest closest community residential care by your home, that are just work in the emerge, because in emergency you don't have same patients every day. It might be easy, it might be difficult, and you are not the only one working everywhere. In emergency, if you have 10 patients, you have 3 people, they will call for a workload. But if you are in a residential home, you have one side A is for this nurse and this support worker, side B is for this area. So you have to change, groom. In hospitals, we don't do that. We don't give showers. We just give them, if they need help, we will give them, we will change them, put them in a gown. If not, they will change in the gown themselves. Easiest is to work hospital emergency for you guys. And difficult for every other group of healthcare team in an emergency. But emergency for a support worker is very, very wonderful. There the job is just simply, and if you are very nice support worker, they will put you, they might take you to the trauma area. In trauma, you might have to transfer the client from this bed to this bed, and you don't hold them on your back. It's just that you have to push the bed. Or you might, the nurse, trauma nurse, she needs amber bag. Go get the amber bag. You know what the amber bag is. you will have to get, just like simply organizing. Or you might be the one who will work as a stalker in, okay, every bed you check, it has oxygen, yes, like becomes easy. But in residential care, if you need one same routine, all my 14 patients are same, we need changes, and then you don't know how. But sometimes residential emergency, it can become heavy. People have an accident. There are accidents, there are bullet shots. Oh my God, every other day we have things going on. That time it is different. So it depends on the days, but still I feel like for CHWs, either home care is best, home support, or home support is the best one, where you get paid also more, and your mileage, you have 5 to 6 clients, we don't do everything for them, you have 3 things to do for them, and that home support number 1 for you guys. Then would be what is it called, emergency. Last would be long-term care. So,
I think I have to try all of them and then decide.
but it's wonderful to try everything.
Yeah.
Don't stick on one thing. Never ever be a glue sticker. Try everything. Okay? And why not? You only have to use your skills. Okay?
Yep.
In a couple of weeks, you will be on the floor.
I'm already on the floor.
Yeah. Welcome, my dear.
Okay, bye. Thanks, man.
Take care. See you. Bye bye.
Bye. Thank you so much.
Bye bye.
Thank you.
Tomorrow.
Bye
Yes. Bye bye.
bye.